In 1 second, technical difficulty. All right, welcome back. Sorry for that. Always technical difficulty. I am sorry about that. I'm just checking the quality of our stream. Give me a few moments. All right, welcome back. Sorry for that. Always. All right. So again, good morning, good afternoon, good evening, everyone. Welcome to the another episode of Ang Artimo, and I am your host, Michael D. Peralta, Ang Artimo. For today's episode, we have Mr. Allan Gonzales from Los Angeles, California, joining us today. He will be joined later by our panelist from Mr. Mark Alfaro, Mr. Ritche Caburnay, and Ms Rinaliza Bogsulen. Thank you to all our subscribers, likers, followers, supporters for our advocacy in promoting the profession, not only in the Philippines but throughout the world. If you have not followed us or like our page on Ang Artimo, please follow us at Ang Artimo Facebook page, Filipino Association of Respiratory Therapists International, our Facebook group, and ang Artimo YouTube channel. So you can follow our live stream and also our archives of the videos that are for our past live stream. It is all uploaded and edited for later purposes. Anyway, thank you again for joining us today. Would like to acknowledge all our respiratory therapists, especially our respiratory therapists in the Philippines and our healthcare workers in the Philippines. We do appreciate all your hard work. We all know that the COVID-19 pandemic had another surge, a bigger surge in the Philippines. So our thoughts and prayer is with everyone. It was an unfortunate news that I have read and have received from the ARCPP. We would like to ask for prayers and thoughts to our kabaga, Miss Joe Suniga, the first known respiratory therapist based in the Philippines that have succumbed to COVID-19. Uh, may I ask for a few moments of silence and prayers to our kabaga, our fellow respiratory therapist, Ma'am Joe Suniga. So, yeah, again, it is a very sad news. Um, Mom Joe, I know you're up in, heaven wherever you are. We salute you for the hard work, for your service to our patients and your service to the profession, and we are praying for you and your family, especially during this difficult time. Also, we are also our thoughts and prayers goes as well to all our fellow respiratory therapists that are currently um, um, I wouldn't say suffering, but are that have COVID-19 at the moment. I have received, multiple, just regular chat from our fellow respiratory therapists that they're currently positive, isolated, admitted to the hospital, and are healing from COVID-19. So if you guys need anything, please let us know. We will reach our hands to those good people that can help you with whatever you need. So stay strong. We are with you. It's just unbelievable how crazy it is right now with the COVID-19 surge within the Philippines. But regardless, this is our job. Our job is to take care of our patients, taking care of ourselves, very important, and taking care of our family. So our thoughts and prayers goes to everyone. Um, also, would like to acknowledge and greet our fellow Christians and Catholics that are observing today. starting today, the Holy Week. So our prayers. I am a Catholic, so we are celebrating or observing Palm Sunday today. So this is the week that we really, it's very dear to Catholics and Christians. So thank you for joining us today. Some of you just have gone to the church or have gone to online service. So thank you for joining us today. Um, all right. So moving forward, we would like to again thank you our past speaker for last week, Mr. Leonard Higoy from Alberta, Canada, who gave us a great lecture regarding MDI with spacer versus nebulizer. And he also gave away 5,000 Philippine peso to our grand winner for last week. It is Miss Fredeline Badol. So our second, who received 5,000 pesos directly from Mr. Leonard Higoy. Congratulations. And our second and third placers, which are Miss Ma'am Bessie Esguera and Ma'am Jessa Milgar, who receive 1,500 Philippine pesos from ang Artimo show. So thank you and congratulations. These are students from Pine City College in Baguio City. So hopefully the little amount that we have, gave will help, in little ways with your whatever needs you have at the moment. So that's all I have. I would like to thank each every one of you. Just stay with us. I will introduce now our speaker or our guest for tonight's show, Mr. Allan Gonzales. And give me 1 second here, and he will be joining us here. Um, all right, we're now live, Mr. Allan Gonzales. Good evening and welcome to the show.
Good evening, Michael. Thank you very much for having me here in the show.
You're very welcome. Thank you for answering to my request to be a guest and a speaker for our show. I appreciate it, and surely a lot of our supporters, members, do appreciate your presence for tonight, as you will share your experience, expertise, and knowledge for RT education and during the COVID-19 pandemic. All right. So now we will start with our question and answer, Mr. Allen. Uh, can you briefly tell us about yourself? I think I would go for a question. From what respiratory care school or respiratory therapy school you graduated from?
I graduated from Mount San Antonio College. It is located here in Walnut, California, in Southern California. It's about, I would say, maybe 35 miles east of Los Angeles.
Mm-hmm.
And at the same time, it is a community college.
Mm-hmm.
That means that that school only awards degrees for a 2 year program in respiratory therapy. But here in the United States, associate's degrees are the entry level to enter the profession, as compared to our colleagues in the Philippines, in which the degree to enter the profession is a bachelor's program,
Right.
which sometimes I'm kind of envy. I hope I could have studied there as
Yeah.
compared to,
Same here.
and then just bring the education here and then enter the program again just to get some more education.
Yeah.
So it's a good program. It's a very reputable school as well.
Yeah. Actually, I have heard of the school before when I was in back in college about 10 years ago when I was in LA. I was looking at that school to be, and looking into respiratory therapy program. So, going, so it's weird that that was my first question, but again, sorry. Where are you from, Mr. Allen? Can you tell us where are you from here in the United States and where are you from the Philippines?
Here in the U.S., I'm from Los Angeles, and in the Philippines, I come from Malabon City, north of Manila.
Nice. Tagalog.
Tagalog.
Yes, and Baha.
Oh yeah, sometimes we go to school. When I was in elementary and high school, I would ride a bangka. So I'm used to it.
Yeah, I mean, even up to now, for sure, our citizens, our fellow Filipinos in Malabon still. I mean, everywhere now, there's still flood. Anyway, on to the next question um, is respiratory therapy your first, I would say, career or profession, or have you gone other profession or career before respiratory?
Well, in the Philippines, I wanted to study broadcast journalism. My
Mm,
mom graduated from UST in journalism.
mm,
My dad from San Beda and UE College of Law.
mm,
But when I came here to the United States, my first choice was accounting.
mm,
Um, but when the recession hit, then all of a sudden everybody is losing jobs except for healthcare. So I said, you know what, let me go and do healthcare. It ended up being respiratory. That's another story. I ended up inquiring about nursing,
mm,
but nursing is a year program. So the next thing on my list was radiological sciences. I
mm,
want to be an X-ray tech because they handle machines, and I love computers.
mm,
However, their program started, so and I needed to start right away.
mm,
So the last on the list is respiratory therapy. So first thing came to my mind is, what is respiratory therapy?
mm,
So I inquired at the office at the college at Mount Sac, and they told me it deals with the lungs. And I said, does it use a stethoscope? I remember when I was a kid, I had a toy stethoscope. I loved it very much. And when they said it does use a stethoscope, I said, okay, sign me up. And the rest, as they say, is history.
yeah. That's awesome. I could relate to that. When I was in high school, I really wanted to go to mass communication, major in broadcasting. That's what I wanted to do. So, luckily, with this show, I was kind of fulfilling one of my dreams to become a broadcaster. And thankfully, YouTube and Facebook is now, fulfilling your dream is not impossible nowadays, especially in broadcasting.
Right.
So here we are. Yeah, that's good. And Mr. Allen, so you graduated from Mount Sac for your respiratory therapy school. If I may ask, what other degrees do you hold, and what credentials do you hold?
Well, prior to respiratory, I got an associate's degree in East Los Angeles College in liberal arts, and that doesn't really mean anything. It's just general education.
Mm-hmm,
And then I went to California State University in Los Angeles. I
mm-hmm,
majored in economics, minor in social and behavioral sciences, and then I, took my master's in education, specializing in adult education administration from Jones International University in Colorado.
mm-hmm,
And then I did a, certificate of advanced graduate study at Northeastern University in Boston, majoring in education leadership management with a
mm-hmm,
concentration on organizational leadership and communication.
mm-hmm. That's awesome. And for your NBRC credentials, RRT, or do you hold other specialty credentials?
Yeah. Currently, I am an RRT, or a registered respiratory
Mhm.
therapist. I'm also an NPS, neonatal pediatric specialist,
Awesome, thank
and
you.
I'm currently working on my ACCS, the adult critical care
Yeah,
specialist
that
credential as well.
that's awesome. I've been working on my NPS and ACCS since I graduated, but there's no need right now, and I'm still on the mend if I would, take it or not. But I think I should. I am not a good test taker. I'm not a good test taker, and I have, my own anxieties too. But eventually, we will get to that.
We'll get to that. The
Yeah,
important thing is you get there. It doesn't matter, just enjoy the journey.
right. And how long have you been an RT?
I've been an RT since 2003, so I don't have a calculator in me, but
Ah,
so, but many years now,
many years, yes.
many years now.
That's good.
But
Um,
it's still young. We are
uh-huh.
still young as compared to our colleagues.
Right,
So
right.
we are young in the profession.
Yeah, we're very fitting to our millennial audience. We still fit in the category.
Yeah,
So,
yeah.
why? So, besides being curious about other healthcare professions or other professions, why respiratory therapy?
You know, one thing you want to look at is at the end of the day, what did you make a difference in the world? Did you make a difference in someone's life? So I took respiratory therapy because I know every day, even though not every day there's a code, not every day there's a trauma,
Mhm.
but even to the fact of a simple nebulizer treatment, if you know that you took care of a patient and helped them or her breathe a little bit better, that is satisfaction enough.
Right. Very, yeah, very true, very true. I agree. Uh, you know, I myself too did not choose respiratory therapy because I know what a respiratory therapist is. I've gone through the loop to been in college in the Philippines, have went to the United States to look at nursing, radiology, technology, and then ended up, being in the respiratory care program in LA, then ended up joining the military. So it's something that, it's very special, something very unique that that you will enjoy, and very versatile. It's a good profession. um Tell us, Mr. Allen, where have you worked? If you can share us those experiences that you have.
I primarily worked in a community hospital, a little bit east of Los Angeles. The one thing I like about that hospital is I did my clinical rotations there. So even towards the end of my schooling, they gave me a full load. So I was just being observed by my preceptors as I tackle on the entire workload of the RT.
Mhm.
And at the same time, it is a hospital that has a lot of protocols, especially therapist-driven protocols. Whenever there's a respiratory patient coming in, all the doctor will write on the medical record or on the order is RT protocol. And that means all of a sudden they're hands off. So we as RTs, we decide everything from initial assessment, a plan of care. We order the meds, the equipment, the frequency, the dosage, and then we assess any changes. It's our decision. The doctor usually will just sign it off. So they are totally hands off. So you know, it's basically practicing and applying what you learned in school,
Right.
as compared to some other hospitals that my classmates have been. You have to wait for a doctor's order, even though you know what to do.
Mhm.
Where I worked, everything was, all RTs in the front line. Doctors are, just agreeing or disagreeing with you, just
Right.
like our clinical simulation.
Yep. So yeah, that's a very good workplace to be in. A hospital where you have therapist-driven protocols. So basically, you're the decision maker, uh, based
And
off
even
the
during
assessment.
intubation, Michael, even during intubation, other than the ER physician or the
Mhm.
anesthesiologist, the RTs will have priority on intubating a patient even before a pulmonologist.
Right. Oh, that's awesome. I've never had intubated a real and live patient, so that's very exciting. Yeah, that's good. I have worked at at least two hospitals that have those therapist-driven protocol, and you really feel that you are that respiratory care practitioner, and not just someone who takes order from a doctor. That's where should every respiratory therapist, should be having that great assessment skills, having those therapist-driven protocol that they can perform their job without or with or without a how would I say it, a direct order from a physician, because again, a specialist of the lungs, we kind of know something, especially we are bedside.
Yep.
All right, thank you for sharing that. And next question is, when you were working bedside as a respiratory therapist, what is your favorite unit? Like, do you enjoy being in a peds, adult, or neonates?
With neonates, I liked it, but for some reason, I can't stay in four corners only. I need to get out and walk. So even though I love working with neonates, I really want adults. Pediatrics. I've always been assigned to pediatrics. I even have you know the uh, the equivalent of any Disney type of scrubs to make it lively for the kids. My favorite being my scrub that's Mr. Incredible, all red with the
Mm,
yellow eye in the middle.
Mhm.
With the adults, I like ICU. Even floor care. People say, "Oh, it's only floor care." No, in floor care, the goal is make sure that your patient doesn't go to the ICU.
Yep.
If they're on the floors, they're breathing, they're having a trouble breathing, then you treat them so they don't get worse. And at the same time, if your shift is done and there's no code in your area of responsibility, then you've done your job.
Right. That's very true. You are the front line, and that person who prevents any possibility of someone getting worse. That's true. That's good. Same here. I don't. I have trained NICU level 2, and I have worked PICU or have trained PICU. My coworkers know that I don't want to be in those units because number one, I don't have the heart to take that feeling of seeing those little people suffering. I don't have the guts and the heart for it. I'm too weak for that. But number two is I can't stay on the unit because you have to be there in the unit unless you go to the bathroom or you're on your break. Rest of your
Right.
12
Yeah.
hours, you're stuck there. Yep, that's
Yeah.
what.
Sometimes it gets claustrophobic too. So,
Right. Yeah, that's one of the reason I did not continue my the degree in clinical laboratory science when I was in the Philippines, because I know that I can't stay in that four corners of the lab. Even if you move me to hematology or chemistry, it's still within the four corners of the lab.
right.
All right. Next question would be um what is your I think this just are the questions so we can get to know you more as a respiratory therapist. What is your favorite ventilator, and what is your favorite respiratory therapy procedure?
Well, the procedure that I like are, of course, intubation
Hmm.
um, and A-line insertions.
Awesome.
Um, and then when it comes to the ventilator, again, I'm mechanical ventilation is mechanical ventilation.
Right.
It's the theory. It's
Hmm.
like, whatever vent that comes to you as, you should be able to adjust.
Hmm.
At least initially, you should know where the power button is.
Right.
However, since I was first exposed to the Puritan Bennett 7200,
Hmm.
that heavy workhorse, then it became the 840 and now
Right.
the 980.
Yeah.
I'm a little bit biased for the Puritan Bennett's.
Hmm.
However, in another hospital where I worked at, everything was servo. So
Hmm.
from the 300 to the 900, 900 and 300, and then the servo I, now the servo U.
Right.
Um, I like that too.
Hmm.
There's really no favorites.
Hmm.
And then when I became a program director at one school, the only ventilator we had was the Draeger. So I had to learn that too.
Hmm.
So I saw the good and the bad. Right now, in one of the clinical sites that I have, they use the GE CareScape,
Hmm.
in which it also does indirect calorimetry.
Hmm.
So there's depending on the features of the ventilator.
Right.
But I'm biased towards the Puritan Bennett's.
Yeah. Awesome. Same here. PB. I've started. I mean, we have learned from the antique ventilators back in respiratory therapy school, but the first workhorse that I've worked with is a Draeger V. Was it V 5000 or VN 500, and then the
500.
PB 840. Yeah, the PB 840. I love
Yeah.
the PBs too. They're simple. They work. They're not that they don't look like they're touchscreen, but they are, and it does the work without the little whistles, the blows and whistles. But again, we're just taking a feel of what as a respiratory therapist, what just a preference of your ventilator. We are not promoting any brand, or we are not.
Right.
Yeah, just a disclaimer. As you said, a mechanical ventilator is a mechanical ventilator. It does the job. Next question would be what is your most memorable respiratory care moment?
Funny you said that, just because one of the most, probably the most memorable for me was I had this patient. I believe, who had ARDS, and supposedly is just waiting, his time to expire.
Mm-hmm.
Um, Alarms are going off, high pressures. We're talking about, 60s, 70s, and 80s. And he was on volume control.
Mm-hmm.
So on a weekend, while I was working, I switched the patient to pressure control with very low volumes but high respiratory rates. Again, it's just one of those things that you learn in school.
Mm-hmm.
And then I talked to the physician, and the physician apparently was on vacation there, so there was a substitute physician, I guess, somebody who's covering, and she agreed with me. So, in the 12 hours worth of time or 8 hours worth of time, I was able to improve the blood gas of the patient.
Mm-hmm.
And remember, this patient has been comatose for, we're talking about maybe 2, 3 weeks now. I started at 6 a.m. By 3 p.m. or around 3:30 p.m., the patient opened his eyes and started writing on a pad paper, communicating with his wife.
Mm-hmm.
When my shift was done, patient was awake. However, that following Monday, I learned that the physician um, came back from his weekend break and didn't like my settings, so I put him back on volume control instead of pressure control. And then the following day, a patient passed away. So my memorable thing for that is, I think at least I gave I don't want to say I gave, but I was fortunate enough to do some ventilator manipulations for the patient to wake up and communicate with his family.
Right. Very important. Most of us has our most memorable moment as a respiratory therapist or as a caregiver. Either it's good or bad, but at the end of the day, you would always have to think that what have you done for the patient and their families. And for your instance, you were able to give that patient a chance to communicate with the wife before passing. And you know it's just heartbreaking. It's a part of our job. Is we are there on their first breath, and we will also be there on their last breath,
On their
unfortunately.
last.
Mhm.
Correct.
All right, so I think that's most of our question, but I think the last two question is Mr. Allen, is what is your message to our aspiring respiratory therapists and our current respiratory therapy students?
You got to love people. I know in my years in education, I've seen students who are really in it for the money. And it's not bad. I mean, you need to live, you need to support yourself and your family. So, money's important. However, if that's your primary goal, these are the people that I see that are burnt out easily. They are the first one to leave the profession. They are the the grouches of
Uh-huh.
departments.
Uh-huh.
For those who really and truly care about taking care of people, they are the one who last. They are the one who usually improves themselves, furthering their education
Mm-hmm.
to improve themselves, improve their practice. So my suggestion for our students is you got to love people, you got to love interacting with them. It can't be a fake. Sometimes you're tired, I understand that, but you got to do your shift, always improve yourself, always be like a sponge, absorb whatever you can, absorb the good and the bad,
Mm-hmm.
because later on you will make a decision that, okay, I'll do the good stuff and then the bad stuff I won't do.
Mm-hmm.
So treat every experience as a learning opportunity.
Right. Thank you for that. Yeah, it's very, those words are very important, especially coming from an educator. You have to know what you're here for the profession. You gotta have to love what you're doing, and you gotta have the heart for what you're about to do as a respiratory therapist. And if you are there for the money or whatever reasons you are there, and that's your reason, and so be it, but you have to have the heart and passion for taking care of patients, because that's what we're here for. um, Last question, Mr. Allen, is what is your message to our fellow respiratory therapists especially for our colleagues in the Philippines. Um, especially during this time of COVID-19 pandemic.
Well, first and foremost, thank you very much for all the service that you guys have done, not only for your patients, but to our profession. I've never seen so many dedicated professionals, that are working in the front line. However, I would like to, even though you guys are dedicated, I would like to advise selfishly that please take care of yourself. Just because if you get sick, then kawawa naman mga pamilya nyo. So you got to take care of yourself first, your family, and then your patients. Um, it'll be pointless if you guys are sick. Then nobody will take care of our patients. So take care of yourself.
Yep. Agree. Self care first, because if we are well, if we are sane, then we can give our 100% every time to our patients. But if we're burnt out, we are not well, then who's going to take care of your patients? Who's going to take care of your family? So
Yeah.
thank you very much for that message, Mr. Allen. And now to our viewers, if you guys do have any question at any point, please leave a comment on our YouTube channel. We are currently live stream on Ang Artimo YouTube channel. If you have any questions throughout the show, feel free to put a comment in there. And if you've noticed any technical difficulties that we're having, just please put a comment in there or send me a message on Facebook so we can address that immediately. Now, for our viewers, we are going for a very brief break as we, excuse me, as we, excuse me, as we prepare for Mr. Allan Gonzales' presentation entitled Respiratory Therapy Education in the COVID-19 Pandemic. So, we are going for a brief break. Here we go. We'll be right back.
Okay. Did you want me to share it or yeah, man, share it now? Okay. I'm still here, Michael. Hold on. Oops. Okay.
All right. Ladies and gentlemen, Mr. Allan Gonzales, with his presentation, RT Education in the U.S. during COVID. during COVID. So if you guys have any questions, please feel free to use the um, comment the chat box on our YouTube channel, and also please stay tuned towards the end of the show. We have our humble 1,500 pesos for our lucky winner for today. Mr. Allan Gonzales, take it away, please.
Okay, thank you very much, Michael. Again, my name is Allan Gonzales, and I'd like to talk about the RT education right now in the US during COVID. But first and foremost, I want you guys to know that this is informational only. This is not a research study, nor it intends to be. This is just a firsthand or eyewitness account on my lens, my viewpoint, my narrative as a personal experience as an educator. And just think of it as a conversation amongst colleagues online. Our agenda for today, I mentioned about the purpose and then, the RT profession who supports us. The types of RT education in the US, you'll be surprised for those who are not familiar with the RT education that it is so different compared to the RT education in the Philippines, which is a straight bachelor's program. And then I'll call a reality check on what's really happening. And then what is the norm? So in order to compare what's happening, during COVID, we need to know what was happening pre-COVID. And then also the board exams, licensure, challenges that face the RT educator, a little bit of a summary, and then of course our Q&A afterwards. And then when we're talking about RT educator, here in the US, there are two types. One is an RT educator in the hospital, and then the other one, the RT educator, or actually, educational faculty in a school or college. So that's what we're going to talk about, and not the RT educator in the hospital setting. First and foremost, the organizations that are supporting the profession is the AARC, which is the American Association for Respiratory Care. They are doing nationwide representation of our profession and its members. The reality is, unfortunately, not a lot of people are being members of the AARC. So that's one of the things that we are trying to convince our fellow respiratory therapists to become members. Just because for them, a lot of our, unfortunately, a lot of our colleagues are just kind of saying, "What's in it for me?" I don't see any improvement in my salary, in my profession. So unfortunately, there is a small population that does not believe in supporting the national organization. And then each state has their own respiratory care society. Me being a resident of California, I'm also a member of the California Society for Respiratory Care, or the CSRC. There's also a National Board for Respiratory Care. This organization creates and administers our board exams. And then you have the COARC, the Commission on Accreditation for Respiratory Care. This organization regulates and monitors compliance of all RT educational institutions in the US. So we answer to them to make sure that we are compliant in our practice in the field of education. Now, the one thing that's cool about our profession is we are partners, and we have sponsor organizations that support our profession. First and foremost, and not necessarily in any order, is the American Society of Anesthesiologists. And then we have the American College of Chest Physicians, which are composed of, cardiologists, pulmonologists, any type of chest or trauma surgeons. And then, of course, the American Thoracic Society. Again, any medical doctor that deals with the chest or the thorax. Okay, so even though it seems like it's the same, the ACCP and the ATS, totally separate organizations. So what are the types of educational institutions in the US? So first and foremost, we have to ask ourselves, are they regionally accredited or nationally accredited? What's the difference between the two? Okay, which do you think is better? Okay, so on my end, it's subjective. Both are good. However, there are advantages and disadvantages in each of the accreditation or accrediting agencies. So we'll talk about first the regional accreditation. As you can see here from the map, the United States is divided into different accreditations. For example, where California is located, we have the WASC, or the Western Association of Schools and Colleges. There are only two states members of that area, which is California and Hawaii. And then each area has their own accreditation agencies. So what do these do? These are majority of the members of the regional accreditations are your typical schools, colleges, and universities like California State University, UCLA, New York University, Stanford, Harvard, Yale, Princeton, University of Chicago, Houston University. So those are when you attend those types of schools or colleges or universities, and not just universities, but also high schools. These are accredited by the government. Okay, so they are, you take a course here, it'll be transferable to another school. Okay, so in our area, we have the WASC. So again, the difference between the two is if you take a course in English, let's say from a university in somewhere in California, if you go to New York, most likely that will be credited. As compared to a national accreditation, majority of the members of a national accredited school are private schools, for-profit private schools. Some of them are known as technical or vocational schools or colleges. And most of their courses and programs do not transfer over. So that means it's only good for that institution. So if you go to that school and you want to transfer to another school, most likely they won't take in your credits. You have to start all over again. Okay, so where I work currently at San Joaquin Valley College, it is a private school. However, we are regionally accredited as compared to another school that I worked at was national accredited. If you take classes there, it won't transfer over to other schools or universities. So the most sought after educational institutions right now are the regionally accredited schools, just because of the numerous opportunities that's being provided. Also, is the RT program a 4-year program, 2-year, 18 months? Is it on campus, hybrid, or is it an online program? Yes, you would probably raise your eyebrows and think, what? There's an online program for RT? How does that work? We're dealing with patients. How can you be online only as compared to if it's a face-to-face, you have to deal with equipment. So how does that work? Also, does your institution offer an associate's degree, which is usually the 18-month or the 2-year? Does it have a bachelor's program? Also, sometimes we call it degree advancement. Now, there's a lot of universities now that offer a master's in respiratory therapy or respiratory care. And then also, there is an advanced practice respiratory therapist. So these are almost like the equivalent of a nurse practitioner, meaning that you are a somewhat independent practitioner. Okay, you could do some surgical procedures if necessary, or other types of invasive procedures on your own. Technically, however, you're still under the practice of a physician, but you just have more scope. Is it a full-time or a part-time program? Okay, so other schools offer a part-time program, especially for those who are working, the working professionals. Now, will the school or the student pay for board exam preparation seminar? So those are the stuff that applicants are considering. Who pays for it? Will it the school, or is it me out of pocket? Practice board exam, the actual board exams, the licensing application, any type of supporting documents. So for example, again, I don't know what is required to be licensed in the Philippines, but I'm pretty sure you guys get some sort of like the NBI clearance, police clearance, barangay clearance, or other types of photo ID. So those are things that applicants consider when choosing schools. The actual RT license, okay, is it going to be paid for by the school or by the student or the graduate? So depending on the school that you're going to, the total cost of an RT education ranges from anywhere between $5,000 to almost $80,000 total, and that includes books, tuition, and other supplemental fees. Now, this is the reality check. So what we hear from students as an educator is, especially if they're applicants or once they are in the program, is I am here to prepare for a job or I am here to prepare for a career. I'm pretty sure this is kind of a no-brainer. Which one are we? Are we looking at this as a job, then we're done? Or is it something that we are more dedicated to the profession of respiratory therapy, that we look at this as a career option for us? Next thing that they ask, and as you can see, some of them are bolded. Those bolded ones are the most common that I encounter, the types of questions that I will hear from students or applicants. How will I be supported by the school? So these applicants are looking for, how are you going to help me pass my class and graduate? That's the bottom line. Next is, are instructors available after class? Okay, so some schools, when you're done, instructors are available X number of hours per day, or, times, how many days per week. Okay, sometimes we call them office hours. In some private schools, after class, your instructor is available to you until the end of business day. Okay, so students still like that face-to-face interaction with the teachers. Okay, so next is, are tutoring available? So again, if they are having a hard time, then they do expect, especially if they're paying or if they're going to a private school and they're paying big money. Okay, now on the side, I would say that majority, if not, I would say more than 99% of the students receive financial aid from the government. Okay, so technically they don't really have anything out of pocket because they get financial aid. However, that aid doesn't necessarily equate to your education being paid in full. It'll depend on your background, your ability to repay the loan, and other factors. Next is there a career center at the institution? Will the school help me find a job? Majority of the schools here in the United States have some sort of a career center or career services department in which their only job is to contact different hospitals, different types of medical institutions, asking, do you guys have any openings? And they try to sell, our students or our grads so that they will be hired. Okay, so that is one of the things that applicants are looking for in a school is, will the school help them find a job? Then other stuff that you will hear from students is, what if I have work and can't come to class? For me, that is, it doesn't sound well. I usually tell, if I'm interviewing applicants, my school, we interview applicants before they get accepted. When I interview them, I always tell them this is a full-time job. This is a Monday to Friday, 8 to 5 type of class. So technically, you don't really have time to work, and I discourage you from working. However, we don't pay their bills. A lot of them are working students. A lot of them are parents, and some of them are high school grads. Some of them are 18 years old. So they have a life, and they, the challenge for them is balancing home life and school life. What if I can't come to class due to childcare? And that's very common, especially for students who have children. Some of them are single parents. Some of them are, has a spouse or partners in life that can't provide childcare. So those are stuff that, students will miss class because of that issue. And of course, my car won't start. My child is sick and I can't come to class. I just had this recent one. I overslept and missed the class, missed the exam. So what do you do then? Of course, it's you would think, well, it's kind of a no-brainer. Then they get a 0. I understand that. But later on, you'll see that there are other factors in which, students, you will kind of have to bend a little bit. Depending on the institution that you're working for or where you're working at. I got snowed in. Unfortunately, or luckily, I guess, we don't have that problem here in California. However, in some parts of the United States in which there is snow, this is a big deal. I'm sick. Usually, if you're sick, hey, go to the doctor or can't attend class. You're absent. You don't get a zero. You get a zero for an exam missed. You didn't submit an assignment, you get a zero. However, because of COVID, there's a lot of changes right now, a lot of accommodations being made to the students. And is it good or is it bad? Again, this is something very subjective. I have my own personal opinions regarding that. However, out of respect for our COVID patients or those who have experienced COVID, I will hold on that one. This is something that, in general, you guys want to think about if this is a good excuse or not. Or a family member is sick, same thing, COVID or non-COVID, or a family member died. I remember before I had a student who said that their grandparent died or their mom died. Okay, fine. And all of a sudden, a few weeks later, their mom died. So a few weeks later, their mom died. So I got three mothers. But here in the United States, it's different because sometimes some students are adopted. So they may have a biological mother, they may have a stepmother or an adoptive mother. So it's hard to judge. It's hard to give a decision whether you're going to give the student a break or not. One of the things that I love students saying is, do I need to get a lawyer or will I get my lawyer involved? Okay, they try to intimidate you. If things are not going their way, okay, they'll say they're going to sue the school, et cetera, et cetera. So again, it's up to you to deal with that type of student. It's just too much. It's too much reading. And of course, can you just teach what's on the test? We can't do that as an educator. In the hospital, if you're working, you can't say, oh, I didn't read this, and this is not on the test. This situation, this procedure was not lectured on. Okay, so you're given a chapter to read. So when they ask me, is there any specific pages you want to concentrate on? Yeah, it's chapter 1, which is basically pages 1 to 30. Is there anything specific topic? Yep, the topic that's between pages 1 to 30. So I had to generalize all my answers, because if you say a specific topic to one person and you didn't do it for another, there's a lawsuit there just because of it's a discrimination. You're providing information to one student and the other student's not getting it. So I've learned over the years to generalize my answer. So they say, hey, Professor Gonzales, what do we need to study for? My simple answer, everything. And of course, the students will have so many questions on and on and on. As you can see there at the very end, I put the infinity sign just because, questions, concerns, complaints will never end. And then you have the FERPA, which is the Family Educational Rights and Privacy Act. Here in the United States, once you turn 18, you're an adult. Even if your parents, or even if the student's parents are paying for the education, and they want to know the status of their child at school, we can't give them details because of FERPA, unless they sign a waiver that will allow us to communicate with parents or some other adults. Other than that, we can't communicate because of the students' privacy laws under FERPA. So I have, a student recently, a student failed, had to be terminated from the program, AKA kicked out of school. And parents wanted to know, hey, what's going on? I'm paying for my child's education. I need to know. And all we could say is, sorry, your daughter did not sign a FERPA agreement. So we can't tell the parent details on why the student was expelled. So what's the norm? Okay, so now we're going to talk about the norms so that once we talk about this, then later on when we talk about RT education during COVID, you could make a simple comparison. So prerequisites, depending on the institution that an applicant is entering, some of these prerequisites should be completed prior to entering the RT program, or in some programs, it is already embedded in the program. So you're taking all the prerequisites, and most of this are your private schools. The completing of the prerequisites prior to entering the program are mostly the the regionally accredited type of institutions, as compared to the ones embedded or included in the program are the your technical and vocational schools. Schedules, again, pre-COVID, of course, everything is face-to-face or live on campus, unless you're in an online program. Usually it's called, the course of study is by semester or terms, which is about 15 to 18 weeks, depending on your institution. Or sometimes they call it modules, which is about 5 to 10 weeks. They go to school almost 4 to 5 days a week, between 4 to 8 hours a day. Could be a morning program, afternoon, evening, or even weekend classes are available. And then the hands-on are in the laboratory on campus. Clinicals typically is about 24 hours a week, or 2 12-hour days, or 3 8-hour days. Depending on some institutions that are like far off, some are even doing 5 days of clinicals, 12 hours each day. Students are responsible for their transportation, food, and sometimes lodging. Okay, so where does lodging takes place? In some schools, they have clinical sites as far as 150 miles, and I Googled it. It's almost the equivalent of 241 kilometers away from the school. And at my institution, we have a 90-mile radius from the school where students can be expected to be assigned. Now, one of the drawbacks of an online program is these students who attend the online program, they have to find clinical sites for them to do the rotation, which is really, really tough. And I feel bad for them. I mean, some of them are successful. So it's like going to a hospital begging, hey, I'm in this program. Will you accept me as a clinical student? Some say yes, some say don't. And that's the challenge for the online programs. So what happened during COVID? For a brief period of time, schools closed. Clinical sites closed due to the upsurge of COVID patients. Everyone stayed home. Students' education and graduation got delayed. So because of that, earning potential got delayed, or even the earning potential is lost, gone, okay? And everyone got stressed and frustrated. So imagine being stressed and frustrated, no income. All of a sudden now they said, okay, let's open up. So during the initial opening of schools, classes resumed via Zoom, Google Meet, or Microsoft Teams. Hands-on laboratory was replaced by watching YouTube videos, or use your imagination. Picture in your mind or pretend you're doing this procedure. That's going to be tough because even though you kind of picture it, you're doing, a ventilator check, a nebulizer treatment, intubation, but you're not holding it. Okay, it's just everything's in your mind, and it's not a bad thing, but of course you need the hands-on. So over time, there's now a gradual opening. So lectures continued via Zoom, Google Meet, or Microsoft Teams, or sometimes even Skype. Okay, on-campus laboratories resumed with social distancing guidelines. So that means, for example, in my school, one classroom, you could accommodate 30. However, because of social distancing guidelines, they made calculations, square footage of the rooms. You could only allow up to 11 people per room. So that's one teacher and 10 students. So that means it's tough. It's time consuming. Pre-COVID, all 30 students are there practicing hands-on. During COVID, instead of the teacher being there for, let's say, a 2-hour lab, the teacher now has to be there for a 6-hour lab or more, just because the first 2 hours, only 10 students could attend. Afterwards, there's like a 15-minute break, cleaning stuff, disinfecting, excuse me. And then the next group of 10 students come afterwards, cleaning, disinfecting, and then the last group of 10 students for another 2 hours. So it occupied the entire day, the entire time for a faculty member. Okay, so what we did was we hired new grads as laboratory assistants, even without RT experience. Of course, the salary is a little lower, the wage is a little lower as compared to a seasoned RT veteran, so to speak, like the clinical instructors or the part-time instructors, but they're there to help out. Okay, so that made it a little bit more manageable. Exams are all online. So is it proctored or non-proctored? Is it recorded or non-recorded? Right now, a lot of schools are going away with the proctored exams or the recorded exams. So they want the exams on campus. Lectures could be still done online, but when it comes to testing, have them go to campus. So same thing. You can't test 30 students in one classroom. It has to be divided into 3 groups. So the challenge there now is, what if one group comes in and then the other group is going out and they talk about the exam? So we have to think of creative ways to make sure that one leaves in one door in one side and the other enters on the, at least in my school, we're like in the middle of the hallway. They could get out from another door while another group of students are coming in, and they can't talk. And we have to have faculty outside to make sure that they don't mingle. So timing is very important. So during class, so imagine this, you are teaching online, again, via Zoom, Google Meet, Microsoft Teams. How do you know your students are actually in your class? They log in, you see a little square on your screen that they're there, their name is there. So the question is, are they at home or are they at work? A lot of students admit they log in, then they do their own stuff. They're at work, they log in, they put their phone down, and then they work. Okay, so their camera's not turned on. So you would say, then have them turn the camera on. Okay, and a lot of stuff, a lot of schools could get away with it. However, according to the U.S. Department of Education, we can't force students to be on camera because it is a violation of their student privacy. So that is another challenge that we have to face. Next is attendance check. Right now at COVID, if you have, let's say, a 3-hour class, if you log in, so let's say from 8 to 11, hypothetically, if they log in at 8 o'clock and leave at 8:05, the fact that they were there, it's documented that they were there. You have to give them attendance for the entire class period. Okay. However, there are some ways that we could go around it. So let's say, okay, they're present, but I'll do an exam at the end of the day, or a quiz, or any assignment, a simple question to see if they're listening during lecture, and then they submit that. So they would get attendance. However, for those, let's say, who are absent, and then all of a sudden their classmate texted them, hey, the teacher's doing an activity, and you log in, you submit the gradable work, any type of gradable work, okay, and then log out again, that's still in attendance. And it's very frustrating for the educator, for the instructor, just because they're not there. And then all of a sudden during exam, they fail, and then they blame, guess what? The instructor, okay? Or I didn't know, just because I didn't know that we have to do this. Well, yeah, you didn't know because you didn't attend class. Okay, so the attendance check right now during COVID is probably one of the biggest frustrations for the RT educator. Just because as long as they show up, even for a few minutes, you have to give them attendance. They are present. If they don't attend class, but they submitted work for that day, and we're talking about from, 12 a.m. until 11:59 p.m., you give them attendance because they submitted, there's a recorded submission of a gradable work for that particular day. So a student, hypothetically, could not attend class and still pass the class by just submitting work or passing the exams. However, of course, there's a disclaimer to that. Some institutions, if you're absent consecutively X number of days, then you'll be terminated from the program. And then for us, it's about 15%. If you miss 15% of class time, you're out of the program. So during testing, how can you protect the integrity of your exams? First and foremost, students can do screenshots from their phone on the computer, copy and paste. They're texting their peers, sharing answers. How can you prevent that? So you need to find creative ways to make sure that exams, although the percentage is big, what if everybody's passing, but sometimes you have to believe your gut. Sometimes it's telling you this student is not grasping the lesson, but they're passing the exam. So what's going on there? That's why for us right now, not only are we big on the exam, something a little bit bigger is what we call learning objectives exam or hands-on. They go to the lab, they demonstrate a procedure. So skills testing. So we resorted to skills testing. Then, it's fair game now because now they're on campus. Also, during exam, is it timed or non-timed, set time frame, or on or before? I put it in quotes, on or before 11:59 p.m. Right now, our instructors are cutting down on to make sure that they're there. You know, when I say they're not on campus, but on the computer, you could only take the exam during class time from 8 to 11. However, other instructors are still saying, hey, you know what? Just take the exam as long as you do it before 11:59 p.m. It's good. And there's nothing wrong with that. But that's one of the things that you, as an RT educator, has to, or at least us here in the United States, as RT educators, what are you willing to do, and what type of policies are you going to make? And that is we have the freedom to decide on that one. So, is it a closed book or notes or open book exam? Okay, so again, that depends. People say, "Oh, let's do open book." Yeah, but if it's open book, but you're timing them, you're only giving, let's say, for a 15-question quiz, you're only giving them 10 to 15 minutes. They don't have time to look up in a book. And all of a sudden, of course, they will complain because there's not enough time. I said, well, if you've studied, it doesn't matter if you open the book or not. You should know. Last is also technology issues. This is a big thing. Oh, I wasn't in class because my computer's not working. My computer crashed. That's why I wasn't able to submit the homework. Can you give me an extension? So again, where do you draw the line? Would you believe them or would you not? Okay, so those are the questions that you kind of have to think about as the RT educator. Upon their graduation, okay, in any of the programs in the US, these graduates are now eligible to sit for or take the NBRC board exam. And the board exam consists of two exams. One, we call it the TMC, or the Therapist Multiple Choice. And then the other one is the CSE, or the Clinical Simulation Exam. So see if you could follow along with this one. If the student passes the TMC at the high cut score, they earn the designation of CRT, which is Certified Respiratory Therapist, and is eligible to take the Clinical Simulation Exam. If they pass the clinical simulation exam, then they earn the designation or title of RRT, or Registered Respiratory Therapist. Once you are an RRT, you can now apply for a license to practice respiratory care in your home state or whatever state you live in. The drawback to that is if you move to another state, then you have to pay a license for that state. Each state has their own licensing laws and licensing fees. However, if you pass the TMC at the low cut score, okay, so there's two scores on the TMC, a high cut and a low cut. If you pass the low cut score, you're still a CRT, and you could work or or get a license in the states that does not have the RRT minimum eligibility, which is still the majority of the states. Okay, majority are still. There's only about 6 states that requires RRT as the minimum. So before we go into that, these are the other different credentials that you could earn through the National Board for Respiratory Care. So again, you have your CRT, your RRT, and then you have your NPS, or the Neonatal Pediatric Specialist Exam. A lot of our children's hospitals in the US are now requiring applicants or their employees to have the NPS. Or if you don't have it, usually they'll give you a time frame like 6 months within hire. And then you have the ACCS, or the Adult Critical Care Specialist. You have the CPFT and the RPFT for Registered or Certified Pulmonary Function Technologist. Again, this is also one exam. If you pass on the high cut, you are an RPFT. If you pass on the low cut, you are a CPFT. And then one of the newer ones as well is the SDS, or the Sleep Disorder Specialist, for those who are doing polysomnography. So each state has their own licensing laws to practice respiratory care, and the fees vary by state. ranging from $75 up to $300 for the initial and the renewal of license. Usually renewals about every 2 years. So guess what? Who has the highest licensing fees, which is the $300? California. Okay, and then the other states are again within that range. There are 6 states that have the RRT as the minimum entry to licensure: Arizona, California, Ohio, Oregon, New Jersey, and New Mexico. So if you are a CRT and you're not an RRT, most likely you will move to another state just because you can't work in these states if you're a CRT only. For those who can't pass the board exams or does not wait, well, not pass, but because you're still encouraged to be a CRT. But for those who do not want to pay licensing fees, then move to the state of Alaska. The state of Alaska is the only state that does not require licensure. So what are the challenges that faces the RT educator? First and foremost, we have to think, what if we go back on campus and do face-to-face learning again? Will we have the same number of students? The reason I say that is because one of the challenges right now is because of the online, students took on employment. Instead of being on class, since they can submit work later on, they took on more work to earn more money. And again, I'm not judging. I'm not saying that you shouldn't, but it's a decision that they made. Next is, how can we motivate, or how do we motivate our students right now during pandemic? Online learning. They need that face-to-face and live connection. So we have to create activities, and sometimes we have to invite them on campus for small talk, just to have that live conversation. Next is, what sacrifice are we willing to make? As the educator, again, instead of spending 2 hours in lab, you're now 6 hours on campus. How do we balance our obligation to our students versus our obligation to the school as the employer? You have one student who's failing, or you have one student who has, I've encountered one student in the past, not in my current employment, who was so frustrated he punched a hole in the wall in the school. Hey, for me, that's vandalism. However, policy states that that student should have been terminated or expelled. However, school administration said, nah, let's give him another chance. So he had to stay. However, we wanted to make sure that he would not become belligerent or even violent. If not, not only will he be expelled, but we will call the authorities on him. Next is, where do you draw the line? Academics, ethics, morals, personal time, sacrifices. I know a colleague from another school who asked the instructors, just go past them. They're failing, but pass them, give them passing grades. I'm thankful and fortunate that I've not experienced that. I know what to do, but it may cost me my job. Okay, so again, where do you draw the line? So you have to think about academics, your own morals, your own ethical beliefs and practices. Next is student interaction. How can we be friendly without being friends? I don't want to generalize. However, it's hard to think that students may take advantage of you being kind or may try to befriend you. And then all of a sudden they may ask for favors. Okay. Next is, how can they take us seriously if we're too nice to them, so to speak? Are you the terror teacher? At first I said, hey, I want to be like that. However, after learning, after studying my master's, getting my adult learning theory, it doesn't work. Number one, yeah, they may do it because they fear you. But for me, I like the students to do the work because they want to. It's not about me. It's all about the students. Okay, so the center of the universe should be them and not you or not me as the educator. I want to make sure that they understand that they're doing this and they're learning respiratory therapy, not only to treat patients, to help people, but to better their lives. So it's all about them. Doesn't matter if I'm happy or not. All I am is I relay information to them. Are you familiar with adult learning theory? One of the things that for me is by nature, adults want to learn, they want to succeed. All we have to do is provide them with the tools necessary to succeed. It is up to them. Will they accept our help or will they resist and not accept our help? But at the end of the day, if you know you've done all your all you can, your best, your job, then the ball's in their court. And the most difficult of all for me as a program director is how do you balance attrition versus retention? Attrition is drops. And then of course, retention is you retain the students. If students are not passing and they're dropping, as an educator, you would say, well, you did what you can. However, as an administrator, as a program director, all of a sudden, then management will ask you, hey, how come your program is dropping a lot of students? Are you guys not doing your job? Are you not helping them? Are you not reaching out to them? Are you not tutoring them? Okay, so attrition versus retention. You need to find a good balance again without crossing, yeah, academic integrity, your ethical and moral values. And then, of course, other things that we could talk about. How can we improve our practice? Should I attend this seminar, this symposium, this conference? And again, the infinity sign is there. So many questions that challenges us as educators, and they're very exciting once you are now brainstorming of possible solutions. So, in summary, know your professional organization. Also, there is a significant change between pre-COVID RT education and the present times. And is it going back to the norm? I highly doubt it. At least not yet, not in the near future. As for RT educators, we must continue to look for resources to help us do our jobs effectively and efficiently. It has to be both, not just one. With the absence or lack of face to face contact, we must be innovative in communicating with our students and making sure that the message gets across clearly. We want to make sure they understand that. Not just, do you understand it? Yes or no? No, don't rely on what they say. They have to do it in either an exam, skills testing, oral testing, so we need to create activities for that. Our ultimate goal is to educate, not to judge these students. They have their own narrative, they have their own story, they have their own lives. Why are they doing this? And who are they doing it for? I always ask that to all my applicants. Why are you here? Who are you doing this for? Oh, I'm doing this for my family. I want them to have a better future, better lifestyle. So when they're slipping up, they failed an exam here and there, I keep reminding them, hey, you got to stay focused. Remember, why are you here? Who are you here for? Think of your kids. You have a job right now that pays you minimum wage. Hey, when you graduate, you'll earn the big bucks. Okay, so sometimes those work, most of the time. Next is how can we support our students to graduate, pass the boards, obtain licensure, and obtain employment? It is a team effort for you, the faculty, the students, your colleagues at the college. Again, if you have an admissions team or you may have a career services team, it's open communication. And that's what I have to deal with, every day. Thank you very much for listening to my personal experiences. I'm also on social media, on Twitter and LinkedIn. I tweet about respiratory and anything under the sun that deals with respiratory therapy or medical. So thank you very much. Maraming salamat po, Michael. Back to you.
All right. Thank you so much, Mr. Allen, for that great um, presentation that you have given all of us with regards to the RT education in the US in the COVID-19 pandemic. Sorry. All right. Let me just. So if you guys have any questions, please feel free to use our chat box. We will be joined by our panelists from the three schools that I mentioned earlier in a few moments. So stay with us. So if you guys want to take a quick break, please do so. and then we will be back in about a few moments here as we are gathering all our panelists with our Google Meet here. All right, so we're gonna go for a short break here. I'll see you guys in a bit. I'm gonna transition us live in probably 30 seconds here.
The YouTube page is our ang RT more, right?
Up.
Okay.
All right, so we're gonna be. Oh, they can hear us live. Anyway, all right, we're gonna be transitioning live. So we are live again. All right, I know you guys are listening to us. Thank you for joining us today. Quick shout out to our audience, our biggest fan from Pine City College, Karen and Jurley. Shout out to you guys. Thank you for joining us today, and everyone who's joining us today. If you guys have any questions at any point, please feel free to type them on our chat box on Ang Artimo YouTube channel. Um, so we are now joined by our panelists. First off, we have Mr. Professor Mark Alfaro, followed by Dean Rinaliza Bogsulen and Professor Ritche Caburnay. So thank you for joining us today, and thank you for taking time to join us this wonderful Sunday. Hopefully, it's a wonderful Sunday. If not, we'll make it wonderful. And still with us, Professor Allan Gonzales, our speaker for today, and our program director for a respiratory therapy program based in Los Angeles, California. Um, First off, I would like to ask Mr. Professor Mark Alfaro, may you please
Yes,
introduce
sir.
yourself for everyone here? Thank you.
Okay. Firstly, I'd like to thank you for inviting me here. And I'm Mark Anthony Alfaro, and I am currently connected with one of the college schools here in the Philippines, St. Jude College, and I am currently the program head. And also, I am also the chief respiratory therapist, one of the government hospital here in Quezon City, and it's actually a COVID center. So uh, that would be all. Thank you.
Thank you so much, Professor Mark, for that introduction. Followed by Dean Rinaliza Bogsulen.
Yeah, good afternoon from the Philippines and good evening to you out there. And thank you so much for this wonderful invitation to be part of this episode for Ang Arte Mo. I'm Rinalisa Bugsulen and I'm presently the Dean of the College of Respiratory Therapy here from Pine City Colleges in Baguio City. So thank you so much for this wonderful opportunity to be with you.
You're very welcome. Thank you, Dean Rinalisa Bogsulen. And then followed by Mr. Ritche Caburnay, Professor Ritche Caburnay. Please introduce yourself.
Hi, good morning, good evening, good afternoon to everyone, to all the listeners of Artimo on YouTube. My name is Ritchie Caburnay, and I'm currently one of the supervisors of the Section of Respiratory Care Services of the Jose Bilingad Memorial Regional Hospital, the largest government hospital in Region 3, and also currently the officer in charge of the College of Respiratory Therapy of the Philippine Rehabilitations Institute in Quezon City. So, good morning again, everyone.
Thank you so much, Professor Richie Caburnay. Again, thank you so much for your time today and taking our, accepting our invitation to be panelists for today's episode. Now, I think my since we don't have any question yet, but I would like to get the discussion going. Please, I think my first question is Mr. Allen and I are based here in California in the United States. And I was a former educator, clinical director for a college also in Northern California. And Mr. Professor Allen is a program director based in Southern California. Um, Briefly, may you guys enlighten us? How does a res how is a licensed respiratory therapist get their education in the Philippines? From being in a college or university and then getting their license. If I may start off, and then as I ask question, just going through my screen right now. If it was mentioned, just and if you want to add more, then the person who's following, if you have anything to add, please do add. Starting with you, Professor Alfaro.
Okay. So first, I'd like to just mention my school where I graduated, and I am a product of Universidad de Zamboanga. So I graduated from that school. I took my 4-year course in BS Respiratory Therapy, and then actually prior to that, I was a medtech student. So I think my heart changed during the process of taking my education, and eventually I decided to shift from medtech to certificate in respiratory therapy. So I after graduating from that vocational course, I decided to still pursue my education by taking emergency. That's another 2-year course, and
Mhm.
after that I am still yet satisfied with what I have achieved. So I proceeded with my PS respiratory therapy. So basically, PS respiratory therapy in the Philippines requires 4-year stay in the college, and after that, you have to take your respiratory therapy licensure exam, and that would took around, I think, 3 to 4 months for you to prepare for that exam. And after taking the board exam and have your license with you, that's when you can start your profession as a respiratory therapist. But I think I will give another time for the other panelists to share with them, because I would be ending, I think, all the process of this BS respiratory therapy uh, in the profession. Okay, that would be, sir. Thank you.
Thank you so much, Professor Alfaro. So, thank you for that. So, an alumnus from Universidad de Zamboanga. So, but you are currently the program chair for St. Jude College in Manila. Thank you.
Yes,
And
that's
speaking
correct.
of Universidad de Zamboanga, congratulations for our top notchers. One and two,
Yes,
correct? And there's multiple. The sheet is, you can see a lot
there
of
were, I think,
graduates
four.
from there.
Yeah, they
Four.
they were four top notchers, and this was actually the first time that they they bagged the first place. The past few years were top twos, but luckily for this year, they really bagged the first.
Mm-hmm.
And I'm really proud of my alma mater.
Mm-hmm.
And I think there will be more to come. And I'm sure not just because of the pandemic, but I think um, the artists now are really stepping one step ahead with in terms of handling the COVID patients. And I'm really really proud of becoming a respiratory therapist as a professional. So yeah,
All right. Thank you so much. Next one, Dean Rinaliza Bogsulen. So I think Dean, when you answer the question, I think I would add to that question. So tell us where you graduated from as a respiratory therapist, and then follow on to the question, please. Thank you.
I also graduated from where I am connected right now. So I'm a proud product of Pine City Colleges. And just like what Professor Alfaro mentioned a while ago, before we had a 2 year program, which is known as a certificate in respiratory therapy, or some programs will call it pulmonary therapy, associate in pulmonary therapy. However, several years ago, it was actually abolished, and now we are on a full 4 year program for a Bachelor of Science in Respiratory Therapy. And after you finish your Bachelor of Science in Respiratory Therapy, then you are already qualified to take the licensure examination, provided that, of course, you have to present the Professional Regulation Commission's requirements. Like, say, for example, there is a required number of clinical hours that you have to finish, together, of course, with the different papers that you have to submit for you to be able to take the licensure examination. And after that, then I guess you can add up the RTRP designation in your name. That means you're a registered respiratory therapist uh, in the Philippines. So, as of now, we still do not have a master's degree program in respiratory therapy. And I hope that in the near future, we will be able to have that one. It will also be a good learning opportunity, especially for us and for all graduates of respiratory therapy. And later on, if I may ask, because I have a lot of questions for Alan. I
Mhm.
have actually quite a few here on my
Mhm.
list, so I hope I'll be able to raise my questions, sir. Thank you.
You're welcome, Dean. Also, if Dean Bogsulen, if I may add, can we mention are you are still affiliated with ARCPP, correct?
Yes, sir. I'm presently the president of the Northern Luzon chapter of the Association of Respiratory Care Practitioners of the Philippines po.
And yeah, thank you for your volunteerism and your for your service to the profession, most especially in the Philippines. We do appreciate all those who are involved in advocating for the professions. For sure, the ARCPP here and abroad, correct? So thank you, Dean Bogsulen, for your service to the profession and for being a great advocate for the RTRP in the Philippines. Thank you so much. And now, Professor Ritchie Caburnay, please go ahead.
Okay, thank you, Michael. Actually, I am a graduate of St. Jude College, Manila, where Mark is currently the department head. I graduated my associate degree in respiratory therapy in 1997. Then I pursued my bachelor's 2 years after that, which is 1999. Fortunately, I was given the opportunity to work in St. Jude College from 1999 until 2017. So before I transferred to another school in Pampanga, which is the College of Our Lady of Mount Carmel, where I became also the program head of the Department of Respiratory Therapy. But in between that experience, I was also currently teaching in Mary Johnston College as professor for respiratory therapy, also from the Mary Childs College, also for the Department of Respiratory Therapy. And until today, that I am currently working as not as only as a clinician, but also as a professor as well at the Philippine Rehabilitation Institute in Quezon City. So I just like to add what Rinaliza said earlier, because supposedly, if you're going to read on the Republic Act 102.4 or the Philippine Respiratory Act of 2009, it was supposedly a requirement for you to be able to take the board examination that you should be a graduate of a bachelor's degree in respiratory therapy in order for you to take the board examination. And after which, you once that you already have passed the board examination, and then you will be able to affix the acronym or the
Designation.
RTRP as part of your credentials. And also, aside from that, of course, there were also what we call the grandfather's clause, which means that if you are a graduate of an allied health profession, but you are in 15 years of service as a respiratory therapist, then you can actually obtain your license without taking the examination, or you are exempted to have the license without the examination. Or if you are a graduate of a certificate in pulmonary therapy or an associate degree in pulmonary therapy, and you have a 15 years of experience in the pulmonary department, then you are also being given the chance to have the license without examination. Or, sorry, let me correct myself. If you are a BS allied health profession, but took but had the 10-year of working as a respiratory therapist, then you are exempted to take the licensure examination. For the 2-year course or the associate degree, you must have at least 15 years of in the profession as a respiratory therapist before you can obtain your license without the examination.
Mhm.
So yeah, that's it.
All right. Thank you so much, Professor Ritchie. Thank you for those added information. Though, those are some of my I would say some of my curiosity regarding the profession, who can take, which, and who is grandfathered. So thank you for giving us, those information. It's very helpful. Now, as we proceed with, as we go further with our discussion, now I am going to open the discussion with questions from our panelists. Now, I will, if I may start, uh, Professor Alfaro, do you have any thoughts or questions for our speaker and for everyone?
Okay, thank you so much, Sir Mike. My question is, as a whole, it's this question is actually as a whole, and I just want to know, or just to get some thoughts from our our panelists as well as Sir Alan. How much do you think this pandemic would affect the quality of education, especially the quality of or product of respiratory therapists of for the future? So since given the fact that the current students who are taking their fourth years or internships are not given the chance to be exposed in the clinical setting, so they were actually more of the um, theoretical. So we respiratory therapists, we believe that honing our practic I mean the skills that we can develop is usually inside the clinical setting. So again, my question is, how much do you think would be the effect of this pandemic to our future generation of respiratory therapists?
Right, thank you for your question, Professor Alfaro. Before we answer that question, let me just read a comment from Mr. Jesus Mario Lopez. Thank you for joining us and watching us today. He said that 10 years of continuous clinical practice, hospital, and 15 years of continuing practice as an RT educator, you are entitled for the grandfather's clause. Thank you for the information, Mr. Jesus Mario Lopez Jr. Thank you, thank you. So now, Mr. Allen, Professor Allen, what's your take on that question?
Well, currently, what we're doing is we've seen a lot of graduates who are, getting work, getting employment in the hospitals. Even though, with the lockdown and everything is online, we make sure that our students are on campus for the laboratory. If the clinical rotations are closed, then what we do is we create so many simulations um, in our school. We have a simulation lab. We have mannequins that we could program. Um, you know, Vital signs, their breathing, compliance issues. They could even intubate and put these mannequins on a vent. And then we create scenarios to them, not just your typical ventilator check or breathing treatments, but we give them, what if all of a sudden the patient started wheezing? What would you do? So I believe repetition is good. Practice is good. So anything that you could do hands-on with them at your institutions, following social distancing guidelines, would be a big help. I don't think the quality will suffer, but the quality in itself is subjective just because that will depend on your students. If they are the highly motivated students, it shouldn't be a problem. The biggest issue you'll encounter are those who needs a little bit more push, those who are discouraged because they don't see the instructors, they don't see their classmates. That's where I see the most challenges are right now. But if your students are motivated, they're willing to learn, I don't think, whether there's a pandemic or not, the quality of your graduates will, be at par or exceed your expectations.
All right, thank you so much, Professor Gonzalez. Now, moving on to Dean Bogsulen. Go ahead, please.
Um, I guess that is, I agree with Sir Island with regards to that. However, one of the greatest challenge that we have here in the Philippines is definitely having or the lack of our simulation laboratory and the different equipments. Uh, More so that we are still not yet allowed to have the limited face-to-face or in-house or in residence as what other people will call it. But that is actually one thing that we have to look into with regards to this education during this pandemic, because as much as we really would like to give the skills and the training to our students, one thing that we have to think about is, uh, do we have the needed equipment for us to be able to do that? Because I really appreciate those institutions who are, I should say, prepared with regards to the different equipments for you to have the simulation with regards to the different trainings and skills that you need to translate year students. And as I've said, that is one challenge that we are facing right now in the Philippine education at present during this pandemic. That's the reason why we are really would like to move for a limited face to face, even for our laboratory courses that we cannot really translate through virtual learning. And I hope that in the next days to come, with the move coming from the Association of Respiratory Care Practitioners of the Philippines, wherein they appeal to the Commission on Higher Education with regards to giving us or approving a limited face-to-face for BS Respiratory Therapy program. And we presented our cause to the uh, IATF Technical Working Group. And I hope that in the next days to come, they will grant us and they will release the memo that they have promised, especially coming from the Commission on Higher Education, that they have promised that it was already approved and that we will be granted the limited face to face that we would like to have. Um, so I am really hoping and praying that we will be having that in the near future, because I guess as we all know, this pandemic will really last for how long, and we cannot afford to let our students, um, be laid back with regards to their learning. And also in relation to that one, no, may I ask Sir Island, if you made some changes or adjustments with your BSRT curriculum, because one of the move of the Commission on Higher Education during the start of this pandemic is to come up with adjustment in the BSRT curriculum. And may I ask also if you had that kind of move in the US with regards to the your curriculum in giving now your respiratory therapy education.
Okay, give me thank you for your question and for your input, Dean Bogsulen. We will get back to your question after we go to Professor Caburnay. Go ahead, Professor Caburnay. Sir, sorry, you don't have an audio. You're muted.
Oh yeah, I'm sorry. Okay, all right. Sorry for that, Michael. Okay, I'll try to cite an example for what happened to my previous students at the College of Art in Mount Carmel in Pampanga. When the lockdown started March 15, they were currently on their internship in Manila, in one of the bigger hospitals in Manila. And during the time of the pandemic, I had two things that is going on my mind. Either number one, continue with the internship in Manila, provided that they will not be exposed into the facility or into the area where in which they're COVID patients. And second, I'll have to allow them to be pulled out of that institution because of the strict implementation of protocols of the students, or the in terms of the age group or the age requirement on who should be going in and out of their homes because of the pandemic. Because at that time, there was an implementation that um, students or in ages between probably 13 until 19 years old are not allowed to go out of their homes. And also, if you are a senior citizen between 60 years old and above, you are not allowed to go out. So at that time, what I did was I pulled out my students from the hospital, and then I just allowed them to stay at home first until the school has given us the opportunity or the go signal in which when are we going to have the internship again. Fourth, unfortunately, there were, in terms of the protocol, supposedly that we didn't have any, or we don't have yet the limited face-to-face classes, because I'm going to revert to what Rinaliza had said a while ago, going back to the decision of the Commission on Higher Education and the Joint Commission for the internships, or for the approval of the internships, there were only 24 universities that were actually allowed to
Mhm.
conduct classes for limited face-to-face
Mhm.
interaction. And those universities are actually the bigger
Mm-hmm.
universities or well-known universities, supposedly in Manila and some parts of the provinces. Now, we requested the Philippine School for Respiratory Therapy Educators also had submitted to the Commission on Higher Education to allow also the RT schools for us to have our limited face-to-face classes, specifically those which were affected by the internship. And true enough as well, what like Lisa said earlier, that not all schools can actually provide the equipment or the gadgets for us to be able to have our interaction with our interns. That's one problem. The other problem is, of course, the approval of the parents, because if we're going to have the limited face-to-face classes, the question there is that would the parents allow their children to go to school from a specific time for them to have classes, even if the protocol allows us, okay, you can, within this age range, they're not allowed or they're allowed, provided that there would be like a number of students or the number of people in the capacity of the classroom. So it's not just only because of the school requirement, but also the protocol of the government. At the same time, also the protocol or the parents, if they would allow us to have classes as much as we want to. But take into that consideration, what I did from my previous interns at that time was able to discuss supposedly well, I was suggesting at the time to have a case study presentation via online.
Mm-hmm.
And then we're discussing the case of the patients and then what would be their intervention and management and whatever. However, again, because of what happened, we only are allowed to like submit certain requirements. So for now, we're just awaiting for what the decision is, if they would allow us still to have classes,
Mm-hmm.
but we're still waiting for the Commission on Higher Education for their decision if they are going to allow us, apart from the 24
Mm-hmm.
universities that has already been approved to have the limited face-to-face classes.
All right. Thank you, Professor Caburnay. So, thank you for the information that you guys have provided, especially with that the Philippine Society of Respiratory Therapy Educators have been pushing for the the um, limited face to face for respiratory therapy education, and that's a big part. And now the next challenge is with goes back to the university and colleges. How would you perform the limited face to face on your own institution? But good thing collaboratively through the PSRTE having that big clause asking the government to open it up. It's a big step, and then going further is through the university and colleges themselves. My take on that is how would the education be affected. I would say not a significant amount. It will be affected, but again, it is subjective. On my personal take, I believe that it will be affected, given that our students are limited with the hands-on experience, which is truly needed in a healthcare profession. But then, with that issue is we are in a pandemic now. Our I think all our job is how do we innovate given the circumstances, and that's a great challenge as well. Not having the appropriate equipment will be something that we need to come up with or be innovative with. um you know um but I think it will be affected. But are there any strategies? Are there any other ways that we can provide it? Yes, we can. For those who have a simulation, they can, a simulation lab, they can broadcast live. If not, then, a traditional case study would be wonderful too. The thing is, we have to keep moving, or are we going to delay graduation? We have to choose. But, case studies, presentation, and, I would say I did this when we got first lockdown in California. We had to use great imagination skills. It's like, you know, ask a student to imagine something, and record themselves and submit it to the teacher. Good thing with education right now is we have our social media, we have our platforms, Google Meet, Zoom, whatever it may be. You can do something on a virtual environment. But thank you everyone for your input. Now, Dean Bogsulen, may you please repeat your question for Professor Gonzalez?
Yes, my question a while ago was, uh, sir, were you able to have some adjustments with regards to the curriculum, or you proceeded as is, even with the lockdowns that you've had experience?
What we did was there was no change in the curriculum. However, there was some modifications that was provided to us by our accrediting commission, which is COARC. A good example is clinical hours. What we do is we report X number of hours per term or per semester to our accrediting body. However, because of the pandemic and they know that the hospitals are closed, they are allowing us, to do clinicals or skills, at school. So again, whatever's the equivalent now. Granted that we really can't do 12 hours worth of skills at the school. So maybe what we do is about the equivalent of 6 to 8 hours worth of work, and then maybe about 4 hours worth of case study presentations, homework, a little bit of research. Um, that is our accrediting body is just saying that the anything that you do at school that is non-clinical has to be the equivalent of what should they be experiencing at the clinical site for their particular semester. Yeah, but in terms of changing the curriculum, no, because usually when we change curriculum, that is something that we have to report to our accrediting body. And at this point, I'm pretty sure that if we do some changes, they'll probably deny it just because of the so many educational institutions in the U.S. that will probably do the same thing. So we were given the leeway, very wide leeway to change our practice.
Right. And if I may add to that, I do remember the instance because in Northern California, we were really affected by the lockdown in California. And, in our area, I was still affiliated with the college, and I have asked specifically our accrediting body. It's like, realistically, right now, we are on lockdown. All students are on campus, or sorry, at home, like, how can we meet our graduation requirements? What do you want us to do? So after 2 days, I have reached out to our higher leadership at school. They reach out to COARC, and COARC reach out back to us and to me and saying that, hey, we have a leeway. You know, whatever you guys need to do on a clinical site, you guys can perform it whatever however you can. It was so vague initially, saying that okay, we'll do case study, we'll do clinical simulation online, and they would credit it as part of your clinical simulation so they can, or their clinical education hours, so they can meet their graduation. So that part was very good. And then the spread of lockdown had reached the Los Angeles airport, southern, central to Southern California. Then I had some colleagues in Southern California contacting me. I remember talking to Mr. Allen before. I'm like, what are you guys doing? And they're still on clinicals. Us, we are in total lockdown. We can't go anywhere. But there are some leeways that our accrediting body have given us in order for our students to keep going, and modifications per se on our curriculum. Yeah. And um now I think Dean Bugsulen, I'm gonna go to Professor Alfaro real quick. What has your institution that you may share have done during the COVID pandemic?
Okay. For the St. Jude College, we actually formulated a framework for the specifically for the fourth year or the intern students,
Mhm.
and we come up with two options, which which was actually a guideline from the CHED as well as from the organization or the body that gives us guidelines on how we can promote on how can we um, disseminate informations to the students to make it more effective, even though if it's in the video conferencing or if it's simulation. So previously we had meetings with educators in the Philippines, and we've come up some certain framework that would best fit for the pandemic like what we have right now. So we chose the blended learning. So that was actually can be applied both face to face, and it could be also applied as purely video conferencing. However, we still had a difficulty on how we could be able to gauge the learning of the students, because we all know that video conferencing simulations or video calls cannot easily be gauged, especially if your students aren't physically there.
Mhm.
So I still believe, as an educator, I believe that the students would best fit or would best learn on a face-to-face basis rather than on a pure video conferencing. So I think that if I were to ask if the education or the quality of the education here in the Philippines specifically would be affected, definitely yes. And I think that if as much as education is concerned, the students were actually piling up the different um, requirements that they are gathering from an online classes, and that is not, I think, mentally, physically, emotionally, the students are really exhausted as of now. So as an assessment on the different year levels that I have handled for the past semester, what I am constantly receiving is the mental uh, the mental problem that they may develop, specifically like the those students who actually had a suicidal student before, and the psychological aspect would also be set in, because we know that
Mhm.
having a daily class on a sitting position would also affect you the overall health of the students, and part of that would also be the development of confidence of the students versus the face to face. You know, there's really a difference between the face to face classes versus the video conferencing. So again, our mode on how we can um our way on how we can disseminate the information or learnings to the students is we have come up a framework or an educational framework specifically for the pandemic, which is we have the option A, which is a modified clinical internship
Mhm.
program, and number which is the option B would be the blended clinical internship, which is a 50-50, which means 50% for the it could be face to face and 50% for the video conferencing. So that 50% simulation, or it could be face to face. The 50% could be on a purely basis of education at home.
Mhm.
Yeah.
Thank you so much. And now, Professor Caburnay, on your institution, what have you guys have done so far?
Well, oh, sorry. Thank you so much, Michael. Well, actually, what we did right now was I made a proposal supposedly for our management to have first the simulation laboratory to be completed as early as possible so that we will be able to have or what we a sort of a video conferencing and or a limited face to face, because right now currently we only have 5 interns that are having our internship supposedly, and they are actually ending their graduating by July. So what I was proposing to our management was to have at least a month or two for the simulation or face-to-face classes, provided that we will only allow to have them like a minimum number of hours for them to go to school supposedly,
Mhm.
given the fact that Probably some because supposedly in terms of age requirement, they're already more. I mean, they're already like matured enough to actually go. However, of course, with the curfew, of course, we are going to be strict on that one. Needless to say, that was the first proposal. The first proposal was to have the classes supposedly for a certain number of time during the two, or probably around 2 months, and then the remainder of the month, probably around May, June, July, if the pandemic or if the number of cases in the Philippines gradually subsides, and if the government already has lifted the quarantine status from ECQ to an MGCQ, then we're going to allow to have that sort of a simulation slash internship from our base hospital, because supposedly our base hospital, we do have a base hospital, but it's not in Manila, however in Pampanga. But the good thing about it is that we can have some of this, we can have our interns to stay and to allow us to have a dormitory or a room that will be provided by our institution. And then they're also ensuring the students that they are not going to be exposed into the different patients, specifically COVID patients. So what will happen there is that the clinical instructor in that institution will do a sort of a come on, let's go, let's have a simulation of mechanical ventilators, arterial blood gases. We'll have a series of case study presentations, or let's have an ABG extraction between staff and the intern, so that at least in a way they're actually learning, but not necessarily facing the patients.
Mhm.
So that is supposedly our proposal. And again, hopefully that if the Commission on Higher Education is giving us the opportunity to allow us to have that kind of a proposal or a suggestion, then it would be great on our end, but not also from my end, but also for the other
Mhm.
schools who also wants to have their students finish the internship or graduate,
Mhm.
that they have everything or all the knowledge and their practical side has been taught to them. So supposedly that's what we're offering right now from our school.
Thank you so much, sir. And then on your end, Dean Bugsulen?
Yes, from our end, no, at our school, our institution, we also had to lean on the flexible learning strategies that we've had during this pandemic. And with regards to our clinical internship, we also had and applied the flexible learning. So the first semester that we've had, since it's really very tight with regards to the different restrictions that we've had, then we went into virtual learning.
Mhm.
So we have case presentations coming from our students' case studies. That's where they were given specific cases that they have to work on, and then they have to do it. They present the cases. We discuss whatever management that they're supposed to do. However, again, as I've said, all are hypothetical cases because they cannot really have hands-on with regards to these cases. And with regards to simulation also, I asked them, like, say, for example, when they are asked to have the vital signs monitoring,
Mhm.
so they have to video themselves. They asked one or two relatives that they have to monitor, quote unquote, and then they
Mhm.
have to video that one. And then we have to, if there are things that needs to be corrected, and that's what we do. I don't know. It's also funny because I also had simulated the duty hours. Like, say, for example, some will actually go for 7 to 3 shifting, and then 3 to 11 shifting. And what do they do during that time? I made their schedule in such a way that they can at least feel that they are in somewhat in a hospital, performing also the shift work that they have to do when they will be a respiratory therapist in the future. And we also had we have, I would say, not really fortunate, but our institution has already our simulation laboratories. However, again, as I've said, the equipment is not as high tech and high touch as what you have there in the US.
Mhm.
But at least we created a simulation laboratory. But I would really love to have the simulation laboratory that you can create a scenario
Mhm.
using a mannequin. You can create
Mhm.
something like if this is the heart rate of your patient or the ECG
Mhm.
tracing of your patient while you are monitoring him or her on a ventilator, and this is the monitoring devices that you have. Still, we still do not have those ones,
Mhm.
but I guess we really have to innovate and we have to
Mhm.
work things around what we have. And I still would like to hopefully at least on a limited face to face that we
Mhm.
will be trying to see our students and be with them, and uh, at least let them see whatever things that needs to be seen, and part of it, no, because we really have to let our students in my plan also at Pine City Colleges is if we will be allowed to go for a limited face to face, even for a 4 months clinical internship in a non-COVID ward or non-COVID facility, that we will be allowed our students to bring them to. And then we have to come up also with a number of days that they will be allowed to
Mhm.
go for duty or clinical internship. And then the rest of the days, they will move for a quarantine period. While on quarantine, they will be working on cases. They will be working on case studies.
Mhm.
And hopefully we also had we conducted a survey with regards to in relation to what Rich mentioned a while ago, that what if parents will not allow their children, even if the school was given the certification and the approval coming from the Commission on Higher Education, coming from the LGU, that they can go for a limited face to face. However, parents will not allow their children. Then we have in our plan, we had to accommodate these kinds of
Mhm.
decision, and we the decision of the parents. So we are really on a very lenient. We provided leniency with regards to our
Mhm.
instructional designs, with regards to our students during this pandemic, because you
Mhm.
cannot really blame parents if they will say that I don't like my child, though we are really on strict protocols,
Mhm.
all the like. However, it's still their decision. And what will happen to these students if they will not, they will opt to go for the virtual learning? Then we proceed with the things that we usually have. So
Mhm.
we created a framework that will actually cater to this group of students,
Mhm.
for those who are allowed to go for a limited face to face, for those students who are not allowed by their parents not to go for a limited face to
Mhm.
face. And that really at the end of the day we will be able to achieve the learning outcomes that we would like to have for our students.
All right. Thank you so much, Dean. That's very true. I think the key here for this one is, flexibility. Though, we want to provide the best for our students, have them, be on camera, while we're teaching or participate on a real time event. But due to the COVID pandemic, is we have to be flexible because again, it's no one's fault. It's not the school, it's not the educators, not the students, it's not the parents. So we have to be flexible in order to cater each and everyone's need. But then again, you know just hang in there. Thank you guys for all your hard work. You guys have a lot of things on your mind right now, which explains I no longer work at the education at the moment. Oh, this is crazy. But anyway, now moving forward to Mr. Professor Caburnay, do you have anything to ask Mr. Allan Gonzales and all our panelists?
Oh yeah, okay. Thank you so much, Michael. Well, actually, my question here would not be actually related to the current situation right now with regards to the COVID-19. I've been wanting to hear, have this kind of information to Sir Alan, because supposedly there were some of my previous students from my previous schools, okay, that are already based in US and in Canada, specifically in US. And I think it's more of the accreditation from COARC. And my question here is that if where is there going is it going to be a strict, or is it so strict in terms of having an accreditation for COARC for an RT school to be accredited? Say, for example, if the student from the universities here in the Philippines opted to have the opportunity to study in US and continue to study there, and then have the license as an RRT. Is it going to be that strict now, unlike before, or is it still the same, or is it going to be lenient? Because supposedly there were some of the I read a curriculum. I saw a curriculum previously from a university in the US that is being sent to me by my previous student, and they said, "Sir, can you check on this one, because supposedly we need to make sure that some of the subject that we're having right now in the Philippines would actually correlate or can be accredited or be accepted in the US schools." So that's actually my first question: is co-art, or is there going to be a possibility that majority or some of the schools here in the Philippines that are having RT program can be accredited or as part of the co-art in US?
Well, so Richie, that's my dream as well. That the graduates of RT in the Philippines, especially all the programs that are bachelors. Here, you still have the associate's degree. When they come to the U.S., all they could do is challenge the board exam. So I'm hoping for that, and that is something that is, maybe it's something that has to deal with the ARC plus the pardon me, but I really forgot the name, but whatever's the equivalent association in the Philippines for the respiratory therapist. A good example is there's one hospital here in Southern California, Loma Linda University. They started a branch over in the Middle East. And then their graduates could come here and sometimes even challenge the board exam. Some schools in Canada, same thing. They could come over here and challenge the board exam. There's a lot of fellowships that's happening, between the U.S. and China, Vietnam, and all those are. I'm not saying that they can't take the board exam right away, but at least for some reason there's some sort of ease into the transition. So for me, that's one of my dreams. I'm just hoping that there should be some sort of a consortium between a COARC and the accrediting body there in the Philippines, so that whatever is the curriculum there, once they go here, maybe they could take a course or two, or at least try to challenge the board exam, because I know there's a clause there somewhere. Any legal stuff may have some loopholes, so that they can become. Because I've seen so many grads from the Philippines who are here but are not RTs just because of that limitation. So they're waiting to go to school, and sometimes they even pay big money just to find a school that's only 18 months instead of the 2-year or 4-year degree, because they already have the degree. But once they're here, all of a sudden they only have an associate's in respiratory therapy. However, they still put on their resume that they do have a bachelor's, except that it's not kind of being recognized. They're only being recognized by their experience. When I was director of clinical education at my previous institution, we had an instructor who graduated, I believe, from Pine City as well. His name is Jonas Mendoza. And You know Jonas. He's a very good friend of mine. He's a colleague.
Yeah, yes,
Um,
yes.
so Jonas, I wasn't at that institution yet, but from stories that I heard when he was a student there, he even told me that he would intentionally try to get at least three wrong answers so he won't get a perfect score in the exam. And the faculty at that time, they were saying, "Oh, he must be a doctor in the Philippines." So when he graduated, there's a minimum requirement of X number of years to get employed as an instructor. However, because of his exceptional ability, he is, they made the exception for him to be an instructor. And now he heads the pediatric unit at LA County USC Hospital, which is a government hospital here in Southern California, LA County University of Southern California. Um, that quick. So again, that's just proof enough that, and I know another graduate who hasn't been, who's trying to get into a school here, but because of the pandemic, they stopped admissions, currently is working as a phlebotomist, so still waiting for that opportunity. And again, I know so many Filipinos here are just waiting for that opportunity to go back to RT school just to practice what they love. And even willing to go to school again as an associate's, recognized by the U.S. and not the bachelor's, just to be an RT. So, I think that the foot is in the door, with Dr. Tiburcio, being an international governor. And then now, hopefully, that the conversation between our two organizations, hopefully, it'll kickstart something.
Mhm.
And then that's something that will have put the burden on maybe Michael. I'll help Michael out to do this.
Yeah.
But let's pray for that. Let's be
Yeah.
hopeful for that. And and for me, I will give my utmost support and time to hopefully make that happen.
Yep. Thank you, thank you. If I may add to that briefly, so yeah, that's a common question that we do receive, and that was also asked when we were at Marriott Manila. Remember Dean Bogsulen with the CSRT reps. So that question was asked: How do we
Yes,
get our
yes.
student graduates to get to get licensed as an RRT? Short answer is the very short answer, for that, which is a very unfortunate answer, is you cannot. You cannot. So that but the hope is, and what we're trying to push is, yes, it can be, but I don't see it in the near future. But again, we are very hopeful that soon, with the representation of Filipino Americans and also our international advocates from the Philippines with the AARC, that's our goal, is to get that going. Though we're going to have an ICRC, or the International Respiratory Care Conference, this coming year again around November. Hopefully, with the ICRC governor to the Philippines, and also I will be, I will try to be present for that conversation. I will bring that up again. We are, as I said, I boasted to everyone here: Philippines, bachelor's as minimum. Why does our students needs to go back? And I know a lot of people here on the US, in the Bay Area, in LA, they're asking me how it get done. The answer is, unfortunately, you have to go back to school. Most of the classes that are being credited are your general sciences, the anatomy, physiology, chemistry, math. Math, they don't question that, because the same thing happened to me. My first 2 years in Trinity University of Asia, they didn't question my general sciences, my math, my they only want me to repeat English. So those are the things that you have to worry about. And the anatomy and physiology in the Philippines is 5 units for most schools. They only credit mine for 3 units because it's missing some more lab hours. But then again, with this conversation happening, like the nursing, they do, the physical therapy, the clinical lab scientists, they credit their graduation, their BS degrees here in the US. Why not respiratory therapy? And from the little research that I do and personal accounts is that um, that the U.S. before COVID-19 pandemic, we have a saturation of graduates of RTs because we're battling our own battles here too. We're trying to advocate for profession, more jobs for us, more things for us to do here. So there's a saturation before. And what happened to Loma Linda University? I don't have the exact information, but that program in the Middle East got closed. Their program cohort said that you can no longer operate, and if you continue to do so, your graduates cannot take RRT license in the U.S. anymore. So that has stopped. And I know that Loma Linda University is a very good advocate for it. That they're trying hard, and our Saudi Arabian counterparts, they do want to get their accreditation and their license too. So hopefully with our first, I wouldn't say first because they already had conversation last time with the ICRC. Hopefully, with this year's, we will be able to get that going, and hopefully, we can get more traction this time. All right, good, good, good. Question now, Mr. Professor Gonzalez. Do you have any question for our panelists?
At this point, not really, but I do want to commend everybody. Like I was telling Michael earlier, I wish I could just go back there, get my bachelor's, and come back here. But with Sir Ritchie saying, there is that barrier for graduates in the Philippines to practice respiratory, just because,
Mhm.
whether it be respiratory or nursing, we are all over the world. It's one of those things that if somebody is saying that, if you work in a hospital, first thing they ask is, do you like Filipino food? So we are all over the world. So first and foremost, with all the challenges that you guys are doing, and I say this with all due admiration and respect. All of a sudden, all my challenges here are now minute, especially with Sir Richie saying earlier that, and this is reality though, that in the Philippines, and with the lockdown that you guys are experiencing,
Mhm.
I can't blame the parents for not allowing their children sometimes to go out or go to school. I don't experience that. Again, if they're 18, I don't deal with parents. It is the students. With Ma'am Rinaliza is saying, I've worked at a school that doesn't have the latest technology, and vice versa. Right now, I have the modern simulation, but when it comes to the equipment, same thing. I'm back to the basics. I work in a school in which we have the Servo 900. It's an awesome teaching tool, just because not everything is calculated for you, unlike the modern ventilator. So the students are forced to do calculations. Um, so those are the challenges that's being met right now. So my hats off to Sir Mark, Sir Richie, and Ma'am Rinalisa for leading the way for our students to get the best education possible with limited resources, or
Right,
whatever resources that you guys have.
right. Right. Thank you so much. We could go further and further with our discussions. I think we need a part two. With time constraints, we need a part two. We need a part two with this, and just solely just having a roundtable discussion with certain topics. And I think the RT education needs, a part two or three, because again, with the current condition, again, with the surge that you guys are experiencing. So thank you guys again for the education part, and with Sir, Mark and Sir Richie being a frontliner as well. We salute you. I don't know how you guys can handle both jobs. I did it for 3 years, but this is my problem in the U.S., which is again like Sir Allan is saying, it's very small compared to what you guys are facing in there. So, salute and thank you to all of you for your service to the education, to your patients, and everyone. Just hang in there. Again, like Sir Allan said earlier, take good care of yourselves. Um, it's unbelievable, with the given face to face, but with the current, sudden surge, and apparently I'm sorry. I get a little bit, kind of excited and emotional with this, what's going on, because we are 1 year into the pandemic, but this has happened. Can we blame people? Yes, we can blame, but what can we do? We do our part to contribute to make it better, right? Because if I just complain here with my microphone on, nothing's going to happen. Nobody's going to listen to me. I am not a politician, or I'm not somebody who is rich who can make a change. You know, I'm just going to be bashed by our social media people. But what can we do is, in our part, is do our little part to make it better, at least in our institution, that we are making changes. And sorry to say, forget about the rest, but at least you make part of in your institution, and you grow bigger. Start within your community and spread it, on a bigger scope. So um um so thank you again. We will definitely invite you again, uh, Mr. Ricci. We will see you next week. He's our guest speaker, and we will announce that later. He'll be our guest speaker for our polysomnography in the Philippines. And then we will have
Finally.
Mr. Mark, because I saw your post, Mr. Mark. That's why I was able to.
Yeah,
Oh,
yes, sir. I was really, really curious about polysomnographic technologies and the polysomnography subject because that's not really, familiar here in the
mm-hmm,
Philippines. And we only we have only few technologists here in the Philippines, and I think that would be really of great help, especially for those RT who wants to be specialized on
mm-hmm,
an area of respiratory therapy. And I think one of the most credible people we can rely on, that would be Sir Richie,
mm-hmm,
because he's been working like he's been registered for like 8 years or 9 years, Sir Richie, no? So I think Sir Richie would really be of great help by implementing and promoting the respiratory therapy, especially in the specialization of that.
mm-hmm. Yeah, thank you so much. Definitely we'll have Sir Ricci by next week, and then we will invite you, Sir Alfaro, for a different topic, and Dean, Ma'am Rinaliza too. I asked a question on our Facebook page on Party, and what topics do you guys want to cover? There's multiple in there, so pick your battle. We need your expertise and knowledge so we can share it, to our students, our fellow respiratory therapists, and it's more so fitting right now with, again, if you guys are reminded, I know, some of you guys are already aware of what our advocacy here on Party and on Artimo is, very informal. We collaborate, we educate, we don't deal with, whatever professional organizations, A, B, C, and D. It doesn't really matter if you're credentialed or not, but it's really, I would be proud if, I have one. It doesn't really matter because we're very um you know uh um informal here, but we have a goal here, and I do appreciate all of you for supporting and, taking this opportunity, taking time to be here today and every single day. I know you guys have your support. I can't wait to go back in the Philippines and meet you guys all again. Hopefully, I was hoping ARCPP 2021, but then again, with the COVID, might be 2022. Hopefully,
Yeah,
we'll see you guys very
yeah.
soon.
I haven't been home since 2015, so hopefully,
Oh,
hopefully
yeah,
as well.
yeah,
Oh, by the way,
yeah,
Michael, I just maybe like some sort of a cliffhanger or an
yeah, yeah.
introduction to Sir Richie's talk in the future about polysomnography.
Mm,
Um, so if somebody has sleep apnea and they die because of the sleep apnea, blocking the airway, and sometimes they may even have a heart attack, lack of oxygenation. So it came to my mind: is this bangungot? When they die bangungot,
Well,
maybe it's
supposedly the
sleep
same.
apnea. Who
Well,
knows? I don't know. So,
okay.
anyways, that could be answered probably in
Well,
a
I
future
can answer
session.
that question. I can answer that question. Yeah, I can answer that
yeah,
question. I'll be ready with that answer on next Sunday. Next
yeah,
Sunday, most likely.
yeah. So Richie, please send me your name of your topic. It's, sleep apnea or bangungot. That would be the. Is it sleep apnea or bangungot?
I'll,
No, just kidding. But yeah, thank you
well,
so much.
I'll answer that one on Sunday.
Thank you, Mr. Sir Allen has a lot of, he has very good humor. You can see on his Facebook page.
Yeah.
Just keep laughing. He just tag you randomly. But yeah, any I think for our audience here, we'll go with your questions, Mr. Allen, your questions here, so we can give away our humble few hundred pesos in here. And then again, to our audience, if you are participating, we would like you to comment on our YouTube comment section by answering Sir Allan Gonzales' question, and whoever gets to answer first will get the point, and whoever has the most will win our prize. And again, we are doing this to help our colleagues and also have to just sort of fun. Don't worry, if I become a millionaire, we'll get that pot money, like 1 million laban o bawi ang Artimo edition.
Sir Michael,
Yes,
can the panelists
Definitely.
participate with that?
we you can make sure you comment first. All right, take it away, Mr. Allen.
Okay, so the first question is, what is the name of the organization that administers the board exams in the
Uh,
U.S. for
in
respiratory therapy?
Okay, what is the name of the organization that administers the test of respiratory therapy in the United States? YouTube comment section. Do you have a clue for our audience, the acronym?
Yes, it is the NBRC.
NBRC. So what does NBRC
Yeah,
stands for?
that's the question, but that is also the answer.
I think now is, what does NBRC stands for? Okay, good. Answer NBRC. So we're looking for the whole complete name of it. Okay, good job, NBRC. We just want you to just spell it all out. Right minus wrong. Wrong spelling is wrong.
Oh, Desiree Antonio. I saw that.
The NBRC. Okay, here we go. National Board for Respiratory Care of Respiratory Care.
For the National Board for Respiratory Care.
Awesome. So our first to get the point is Desiree Antonio. Is that right, Mr. Allen?
That's correct. That's the first one I saw. Congratulations.
Thank you so much. All right, next question, please.
Okay, next question is, what is the name of the organization that represents all of the respiratory therapists in the entire United States?
Yeah. What? Okay, you have to spell it all out.
Spell it out.
Which also has multiple international affiliation, including the Philippines. All right, let's go, keyboard warriors.
I wanted to answer, but
American Association for Respiratory Care. Desiree again. Whose student is Desiree? Is she a student or a practitioner?
She's my student, sir.
Wow.
No wonder.
Very good. Very good.
Thank you. Thank you.
She probably passed her typing class.
She's fast. Not only she's fast, she has good internet connection. Tell us on the comment section who's your provider.
yeah.
All right, next question, please.
Okay, next question is, How much is the licensing fee, initial and renewal in the state of California?
All right. It's in US dollars. How much is
Yeah,
the
I
licensing
didn't calculate
initial?
the equivalent for pesos yet, so
All right. How much is the initial licensing fee and renewal fee in the state of California? Clue, it's very expensive.
yep. I gave a range
Oh yeah,
earlier. It's the top of the range.
And you know it's going up, Alan, for the next few years.
Yeah, it is.
Yeah.
Wala na sa bingo, wala pa rin sa kalendaryo. So,
Oh God.
yeah, I'm telling you, that's something. Something's going
Des
on.
I know Desiree says 300. She's really fast. I think we got a winner, but ask the last is $300 the correct answer, Mr. Allen.
$300.
All right. Awesome. Thank you, Desiree. You're quick. And the last question is
The last question is: what are the 6 states that require an RRT entry to licensure?
woo,
What are the 6 states that require RRT entry to licensure?
that's difficult. I don't think I can get a point for that either. What are the six U.S. states that requires RRT at the minimum? All right. Well, we're waiting for that. Again, I would like to thank Mr. Professor Mark Anthony Alfaro, our program head for FINMA, St. Jude College, Manila, and our chief respiratory therapist at. Go ahead, sir. Can you tell me? That's a fairly new hospital you're in, correct, Mr. Alfaro?
Yeah, sir, I am connected with Rosario Macnang Bautista General Hospital here in Quezon City. It's located in Batasan Hills.
Yes, I that wasn't existent yet when I was there. How old is the
Yeah, it was
hospital, sir?
actually it's about 2 years now. So I'm one of the pioneering respiratory therapists of this hospital,
Mhm.
and luckily, I'm still you know um, standardizing treatments, procedures, and etc.
Mhm.
With of course with the mentors of mine
Mhm.
that are seniors now in their respiratory therapy field. So actually to add on, Sir Ritchie was actually and Ma'am Bogsulen, uh, they were my former teachers. So yeah,
Nice.
Sir Richie and Ma'am Bogsulen were actually my former teachers when I was back when I was still studying.
Mhm.
So uh whenever they speak or whenever they mentor or say something, I would really definitely believe with that because as a early professional of the respiratory therapy, I have really a high respect with those respiratory therapists who became mentors and for teachers back when I was still a student.
All right, thank you, Mr. Allen. Do we have a correct answer in our chat?
Yes, the first one that I saw that has all 6 is Giselle Precious Alvarez.
Thank you, Miss Giselle Precious Alvarez. You got 1 point, but how is that? Is that the last question, Mr. Allen?
Yep.
All right. So we have a clear winner here. It's Miss is it Miss Desiree Antonio. Congratulations. Please message ang Artimo. Please first of all like and follow ang Artimo Facebook page and send a message through there and we'll get connected and we will send
Yep.
you your winnings through there. Thank you so
And then
much.
and then also the last question, Michael,
Uh,
the one with Miss Alvarez, Giselle Precious Alvarez for the last question.
Oh yeah, and she got a point for that. So yeah, please do message on our Timo Facebook page. All right. Thank you. Mr. Mark Anthony, thank you for that. Yeah, remember that hospital? It's still brand new. Quezon City Hospital. I was looking through that last night, and I said, it's a good hospital to have in Batasan Hills. Definitely needed. And any parting words for us, Ma'am Rinaliza Bogsulen? Um, we are hearing that you have been a mentor and educator for many respiratory therapists, but you look like you're 30 years old. So I can't believe what people are saying here.
I'm so humbled by that comment, Michael. Thank you. Uh, I thank you so much,
Mhm.
Sir Island. Thank you for the time that you have taken. I hope that we will really have a part two and a part three
Yeah.
because I still have a few on my list that I
Mhm.
haven't given you and I haven't asked you. So definitely, I will be reserving that for the next episode that we will be having together with you and to Mark and Richie. Thank you so much. I just a disclaimer, I'm not Sir Richie's mentor, please.
Oh my goodness.
Thank you,
For the
everybody.
record,
Yeah,
yeah,
thank you,
for
everybody.
the record.
Actually, Ma'am Rinalisa, I was telling Michael, he has my email address.
Mhm.
I would love to get in touch with everybody, keep the connections, network. Feel free to ask me questions. We don't have to wait until the next
Yeah.
roundtable. Email me your questions, ma'am, and I will answer you right away.
Yeah, thank you so much, sir, for that indulgence. And I salute those people, Mark, for juggling your time between the academe and the clinical. Also with Sir Richie. Sir Richie is actually the male counterpart of Kuracha. If you know ang babaeng walang pahinga, that is actually Sir Richie because he juggles his time between several institutions and still manage to teach. And I really salute you guys. Thank you. And let's all be safe and be well. And Michael also for having this learning opportunity, collaboration for everybody, may it be a student or in the profession. And thank you so much. I cannot really express how I am grateful for you guys for this wonderful opportunity, and I really, really hope that the collaboration also for the academic side will come. Maybe Sir Alan mentioned it's actually the foot is at the door, and I hope really that we will finally enter the door and finally enter that room where we can actually have a good collaboration and really work. I know I have several students also, and some of them are actually my batchmates who went to the US and had to go back to school just to work in the US as a respiratory therapist. Joyce Mendoza actually came ahead before I entered respiratory therapy school at Pine City Colleges. So I'm also glad that he is doing well in the US. I hope that he can also help us uh, in the Pine City Colleges and help us also how we can train and how we can move other people, no, moving to the US, to the Canada, and definitely it's a work, a lot of work to be done, but I believe with everybody's participation and with everybody's help, it is doable. So
Mhm.
thank you so much.
Thank you so much, Ma'am Rina Lisa Bogsulen and Mr. Ritchie Caburnay.
Thank you so much, Alan. And again, thank you, Alan, Sir Alan and Sir Michael, for the opportunity of being a part of this roundtable discussion. Again, I know that at the short span of time, we've learned so much about our profession in not only in the academe, but also in the as a clinician. And I think that based on my experience as a clinician and an academician for a very long time, I know that I'm not your professor, Rina. I think that you were ahead of me for a few years, but kidding aside, actually, I think that it's not just only you learn the students doesn't only doesn't have to learn something in the theoretical aspect. That's the reason why I'm still uh, I mean, I'm still working as a clinician because I wanted to partake to students that there are certain things in the textbook that are not anymore applied when you are already in the real world. So just like in any textbook, there's always an edition, and those editions are being expounded. It's being improved so that when you go into the clinical practice, you're able to learn something that does not require you to say, "Oh, it's because from the book it said that it's like this." Because sometimes, as the saying goes, experience is the best teacher. And what you see during the internship will be able to enhance your knowledge and skill as a respiratory therapist and not just only relying on the text. That's the reason why all of us here in the Philippines, in the Philippine Society for Respiratory Therapy Educators, would have wanted so much to have the opportunity to teach the students the the technical competency in becoming a respiratory therapist and not just relying only on the book. And I'm basing it my experience in the COVID area that whatever that I've learned in the book, I've already have applied it in the clinical aspect, and I wanted to teach everyone as well because I think right now it's not just only the BSRT students that are graduating because there are also I wanted also to give opportunities to those uh, were fellow respiratory therapists who have graduated the associate degree in respiratory therapy and was not given the opportunity to take the board exam because my advocacy as well is to allow them to get into a 4 year BS respiratory therapy program. Also, those who some allied courses that are trained to become a respiratory therapist, for example, nurses, physical therapists, or any other profession that because of the scarcity of respiratory therapists working in the Philippines, some of them opted to go to other countries for greener pastures. So what happens here is that there are only few RTs that are training or being trained in the Philippines to become an RT. So we don't have any choice but to accept all other allied health professions who wanted to be on a subspecialty for respiratory therapy. But of course, if they wanted to take the board exam, they need to follow whatever the protocols or the policies that we have in the association and in the PRC. That's the reason why we wanted to give them the opportunity to study the RT program for them to be able to, fully practice what the profession is. And I'm very hopeful that through this Michael's YouTube channel and also through Sir Allan's advocacy and all of the other respiratory therapists who wanted to help other respiratory therapists to pursue their dreams in becoming a professional or a licensed, feel free to send us a message. We wanted to help all of our fellow respiratory therapists, also all the students who wanted to take time to have study or to have the licensure examination or a review. We're very much open for us to give that opportunity to others. And again, this is a great um, opportunity for the YouTube channel to be able to have that one. So with the sub-depression and polysomnography, I'm looking forward for all the RTs who wanted to become a sleep technologist as well, who wanted to be a licensed sleep technologist, because I'm going to just give you a quick note on that one. If I was being trained in the Philippines to become a sleep technologist and was able to pass the licensure examination as a sleep technologist here, and because that's BRPT, why can't we have the licensure for respiratory therapists in US and also had an opportunity to study in US where all credentials can be accredited? And I think that will be the best opportunity, not only for me as an RT and as a symptomatologist, but also give us opportunity for other RTs as well to practice RT and symptomatology in US and any other parts of the world. So that's my farewell take on that one.
All right. Thank you so much, Mr. Ritchie Caburnay and Mr. Mark Alfaro.
Yeah. Thank you so much, sir. First, I'd like to thank you for inviting me here. And this was actually one of the most this was actually the first time that I appeared in the YouTube channel. And thank you so much for that. And it was really a great opportunity to help the students, the respiratory therapists as a whole to be able to be recognized not just here in the Philippines but also um, internationally. And one of the most one of my advocacy uh, from the day one of being a respiratory therapist is to be able to um, to spread the respiratory therapist contribution here, not just here in the Philippines but also internationally. So up until now, I am really still in the um, making RT a big name here in the Philippines. If other healthcare professionals are widely known, why not RT aren't part of that league? No. So I'm one of Sir Richie. I know that Sir Richie was also one of the artists who keep on making RT big here in the Philippines. And I believe that even those, and even the salary here in the Philippines would speak in behalf of the RT. So there is really a difference when it comes to the salary. So if we have big contribution here in the healthcare system, why aren't we included in the league of having equal, salary or even basic salary? So again, my take on this is I want to make RT as big as like those healthcare professionals working, having a big impact, especially right now in the pandemic. So we know that RT has really big contribution when it comes to critical care. And uh, with that, I want to make it more recognizable, not just in every institution, but in every hospital here in the Philippines. Because I know artists really deserve that. And once again, thank you so much, Sir Michael, for this opportunity, and Sir Alan for being also an educator and helping the RT organization to be, you know, um, educated in terms of not just the quality that you can share with us, but also to be part of the organization that contributing the betterment for the organization as a whole or association as a whole. Thank you
No,
so much.
thank you so much. And Mr. Allen.
Well, thank you, everyone, Sir Mark, Sir Richie, Ma'am Rinaliza, to all who have watched and participated. Um, just keep pushing. Always believe that there's always a light at the end of a very dark tunnel. So, just be sure that you are in the profession because you love to help people. But at the same time, like we were saying earlier, take care of yourself, take care of your family because family comes first. That's the most important thing.
Mhm.
So mabuhay po kayong lahat, and thank you very much.
All right. Thank you, Mr. Allen. And for me, I would like to thank you, Mr. Allen, Mr. Mark, Ma'am Rinalisa, and Sir Richie for your time for this show. But again, just just with everything that you do, I do really appreciate you. And parting words for all our audience is just I would say they're saying that it's not where you planted, it's where you grow. So regardless of where you are right now, you can always grow, whether it is in the Philippines, Middle East, Singapore, US, Canada, wherever you are. Some people don't compare your blessings to other blessings, right? Because your blessings is for you and others is theirs. So continue to grow where you are, because blessings will always come as long as you work hard, and you are in a very good profession, I would say. I would really say, regardless of where you are, respiratory therapy is a very is a profession that you can always grow, and you can always touch so many lives, and that's what's more, that's what is important with our profession, because we touch so many lives. So thank you guys. And um add volunteer to your professional organizations, and do something within your community, within your institutions, because that's how we're going to start for more people to recognize our professions. And hopefully in the near future, where big people can really know who we are, they will get to know us, and they will help us more. And I saw one share on our Facebook page about a higher politician. I would not name her. That's a clue. She's second highest politician in the Republic of the Philippines. She knows what a respiratory therapist is, and that's what really matters, being recognized. And she knows, and she mentioned that her sister is a nurse, and she knows how respiratory therapists are hardworking, and she recognized everything that you do, regardless of your political stand. People do. We don't look at the political stand. We look at those people who are empowered to look at us and recognize us, and that's what's important. And hopefully, more of her, like her, would recognize our profession. And again, thank you so much for this time. For taking this time again, and I do really appreciate it from the bottom of my heart. Maraming salamat po. We'll keep in touch. I will send on the we have a group chat. Please, Mr. Allen, give your email out to our panelists. And again, if you guys need anything from our end, we're always here to support you and your institution. We are, as long as our schedule permits it, and you guys know that. And again, because this is the episode 4 of Ang Artimo, you guys are officially all my artists. You guys are all my artists. Maraming salamat po, and thank you for all our audience today. Until we meet again on our next episode, and please continue to support us so we can keep this weekly webcast that we have. Again, thank you so much, and I will be ending this show right now, and we'll see you guys next week, 11 a.m. Manila time, and wherever you are in the world, just Google it, and you will find the exact time in your area. Maraming salamat po.
Salamat.